All right, testing. Okay. Good morning. Okay, YouTube world, if you can hear me, leave me something in the chat. Let me know that you can hear me. So if you guys can hear me, leave me something in the chat. Let me know. All right. Happy Monday. Good morning. All the kiddos are back in school. The school buses were a factor this morning. All right. So over the weekend, you guys had chapters 5 and 6. I told you 5 was on dementia. It was an important chapter, but 6 we're covering mostly in class. Read the paragraphs in between. Does anybody have any questions on what you read? Anything I can help you with or explain? If you missed anything, do you know why you missed it?
On 5?
On 5 or 6. I'm not sure why I have no comments here. Okay, guys, if you can hear me, let me just check this. So, mic check. Can you guys hear me? Can you hear me?
Okay, guys, if you can hear me.
All right. Looks like my mic is working. I'm just not getting any comments right now. All right. This tech stuff is going to drive me gray hair. All right. So let's see how you did on chapters 5 and 6. When I call your name, give me your scores or how many you missed. Mariah, Karina.
90 on 1 and 100.
Okay. What about chapter 4? Do you have 4 for me as well? Thank you. Zion? Thank you. Do you have chapter 4 for me?
Yeah, I have 100.
Thank you. Janisty?
Do you need my chapter 4 too?
I do.
Okay, so I got 100 on chapter 4, 5, and 6.
Very good. Jennifer? Rylan? Jashanti? Alana?
I got 80 on chapter 5 and 75 on chapter 6.
Okay, what about chapter 4?
I will do that.
Okay. Do you have any questions on the ones that you missed on 5 and 6?
It was number 4 in chapter 6.
Let me just pull that up. Hold on 1 second. Okay, which of the following are important considerations when using an electric razor? So we never want to mix flammable stuff with electricity. That's never a good idea. So you don't want to use an electric razor when the patient is on oxygen. Does that make sense? Yeah, just because of the risk of fire. Oxygen is flammable, but not combustible. So there already has to be fire. It doesn't just like automatically out of thin air go poof, right? But if fire exists, it's going to amplify it. So if we have a spark, which sometimes happens with electric razors when you're going, especially if somebody has really coarse facial hair, you can get a little sparking going on. So if we have a spark and oxygen amplifies that spark, it could be bad news bears for our patients. So no electric razors when our patients on oxygen. The newer razors help prevent that. There's some mechanisms in place to help prevent that. But for the test, we're just going to remember, probably not a good idea. Regular razor, much better. All right, Desiree. Allison.
For chapter 5, I got 3 wrong.
Okay.
And for chapter 6, I got 100.
Very good. Kristen.
Chapter 5, 1 wrong, 6, 100.
Thank you. Keely. Thank you. Delilah. Thank you. Rebecca. All right. Did I call everybody? Okay, everybody. All right. Oh, I got comments. Okay. All right. Oh, thank you. That's very sweet. I love your class. Thank you. All right. So we are so much to handle here. So we are going to review a few things that we've learned because the weekend was a very long time. And I want to make sure that you remember what you need to remember so we can employ those principles moving forward. Now, the weekend was a very long weekend for me. I worked about 18-hour days from the time that I left you until this morning, trying to get the new book done. Made great progress. Super excited. I'm going to show you a couple pages. I printed them out. So a couple of pages of the new format. You guys, as students, can tell me what you think. So you're going to actually be able to influence this next book. And the books are in circulation for about 5 to 6 years. So big responsibility for you. I value honesty because these books are going to be used by students all over the country for a very long time. I need input from actual students. I actually have a couple instructors that I've sent it to, and I'm getting their impact at, their input as well. So we're going to be going over that a little bit later today. But before we get there, let's look at skill rules. So we're going to review here. So when we are going, how do we know what to do with each patient? The care plan. All right. So we're going to perform the skill as directed on we're going to follow the care plan, the whole care plan, and okay. And I know that's very simple, right? It's deceptively simple. But I repeat this over and over and over because when you get to the test, trust me, your brain is going to turn off. You're stressed. You're scared. This is a really big deal. And on top of all that, you're being watched, right? Your brain is going to absolutely shut down. And when your brain shuts down, you have to know, where do I start? Right? If you have a starting point, then you can keep going. But where do I start? When your brain has exited, stage left, gone, I want this to be in your head, the care plan. That's it. 3 words. It's all you have to remember, the care plan. Once you remember those 3 words, you can forget your own name. That's fine. If you can remember those 3 words, the care plan, then when it comes to tests, they're going to hand you that care plan. You know that beyond anything else, if you can't remember how to wash your hands or how to give a bed bath, which we're going to cover today, or how to do range of motion, it doesn't matter. We're going to follow that care plan. And when we read the care plan, some of those things will start to come back to you. Does that make sense? Now, I know it's stressful. I get it. But I've been doing this a very long time. And we've had a lot of students that have taken the test and come back and told me, Miss Patty, it absolutely happened the way you said. I got in there and I froze and I didn't know what to do. So I read the care plan. And then that helped me remember the steps. I heard you in my head. So I say this over and over and over again because I know what's going to happen to you on testing day. I know that you're just going to freak out. You're going to freeze. So I've got to give you a very defined starting point. And that's what this is. Good? Questions? Okay. So while we're following that care plan, what are we going to look for?
Observation.
Yeah, abnormal changes, pain, something that doesn't look right. And then who do we tell about those? The nurse. All right. So every skill that we do starts with the opening. What does every opening start with? A knock. Now, told you I worked 18-hour days on this. So let me show you something. If you look at these, right, we've seen these, right? You guys remember these, right? If you look, they're not all together, so I have to be careful here. If you look at every checklist, all of these checklists, right? Every single one of them, every single one. Under indirect care, okay, down here under promote residents' rights during care, the very first checkpoint there is announce self or knock before entering room on every single checklist. So if you don't knock, it's an automatic deficiency. Does that make sense? Got it? That's how important knocking is. And you guys are going to have some practice time built into class today. When you start practicing, some of you are going to take shortcuts. You're not going to knock. You're not going to do the opening. You're not going to pull the curtain. You're not going to go over and wash your hands. You're just going to go straight to the skill. And guys, you've just missed about a quarter of the checkpoints of the skill. Don't do that. Because the way that you practice is the way you will perform. Remember, your brain is going to take off on you on testing day. So if you're practicing by cutting corners, when your brain isn't engaged, you're going to perform the way you practice. So when you get to the test, you want to be able to do this on autopilot. That means that you have to put the work in here. Does that make sense? You're going to do the entire opening. And the opening starts with a knock. That is super important. If you look at those checklists, the opening and the closing makes up, and I actually did the math, the opening and the closing makes up between a third and a half of every skill. Those are the checkpoints. You are getting credit for almost half of every skill simply by doing the opening and the closing. So they matter. They count. So what are we going to do with our patient? How do we know we have the right person? Okay, can we use any pet names? Honey, dear, love, sweetie, cutie pie, anything like that? No, you will give somebody the wrong impression. Absolutely. But it's also unprofessional. Remember I said we have an image problem as CNAs? We have to act more professional if we want to be taken seriously and get the wages that we deserve, right? Well, this is part of that. But it's also a graded checkpoint on every single one of those checklists. It actually says addressed resident by name. And another one, refrained from using pet names. That's how important that is. That's why it's up here. Now that we know we have the right person, what do they need to know about us? Name and title. Yep, name and title. So we have to introduce ourselves. Absolutely. And then we want to tell them what we're there to do. So we're going to describe our skill. Now, the reason we're describing our skill is because our patients have the right to refuse. So what do we need to get from them before we move on? Yeah, permission, consent, the okay, right? What if we get an okay and then halfway through the skill, the patient says, stop, get off me? Yeah, you stop. No means in every situation. No means no. Your patient has the right to refuse. There was a article last week about this very thing. A patient refused care during care because the CNA was hurting them. And the CNA did not stop, just kept going and forced the patient to allow them, to be bathed. It ultimately was discovered by the family, and the CNA was reprimanded for it. It's a battery charge, guys. It is no different. Me trying to do foot care on this patient after she says no is no different than me grabbing your foot sitting here. Same action, right? The only thing that changed is the location, the roof, the building. That's the only thing that changed. So no means no everywhere. And sometimes as healthcare workers, we forget that because we get so focused on what we have to do, our list of tasks, and we start making it about me. But who should it be about? Always. That's why it's on the opening. Yes. Big, big deal. Once we get permission, what are we going to close? The curtain. Now, this is interesting because I've been doing this a long time. And like I said, over this weekend, I did a really deep dive into this checklist. I mean, way deeper than I've gone before. And it's interesting because as I was cross-checking all of this, for me, I pull the privacy curtain for everything. It's just a good practice. We're going to learn that we don't use privacy curtain for feeding a little bit later on in the program, but it's just a good practice. But it's actually not required on every skill. It's not required as a step. I think it should be, because when you pull the privacy curtain, you're making yourself aware that the patient deserves privacy. Does that make sense? So it's actually not required on every single skill, but for me, it is. Okay. But once we've touched that curtain, what's our next action? Yeah, because that curtain is not clean. So let's talk about hand washing for a second. Do we have to wet our hands before we put soap on?
Yes.
Why? Yeah, to lather, because we are graded on bubble production. Yeah. How long do we have to rub together? Does that include our nails? No. And then we're going to rinse. What can't we touch when we rinse? Yeah, anything. Anything but water. Yep. And then after we rinse, do we turn the faucet off right away? Okay, can we touch that faucet with our hands? Why? Right. Very good. Very good. So we're going to dry our hands, throw that away, get a clean, dry paper towel to turn that faucet off so that we don't risk cross-contamination. Good job. After we've washed our hands, then we can go get our supplies. And the supplies start with a barrier. So it's the first thing that we're going to get, because we have to have what kind of an area for our supplies? Clean area for our clean supplies. And we want to make sure we get that barrier first. Don't try to juggle all of these supplies and lay your barrier out, because your supplies are going to touch your uniform, and that is a graded checkpoint on every skill that uses supplies. We can only touch supplies with what kinds of hands? Clean hands. And what can't our supplies touch? Yeah, your uniform. Very good. Very good. I also, again, deep dive, those supplies, they can't touch your uniform. I need to add this in, but they also can't touch the bare table or the floor. Those are graded checkpoints. It actually says on several of those skills, did not place soiled linens directly on the floor. Now, to me, that's kind of a no-brainer, but it's an actual checkpoint that you've got to get checked off. It also says do not place soiled items directly on the tabletop. Well, if we're using a barrier, nothing touches the tabletop, so we're covered. Good? Make sense? All right. So glove rules. Do we wear gloves for everything? No. Why? Yeah, they don't actually save you. Absolutely. Absolutely. And we stop paying attention to what we touch. And that's what's ultimately going to put our patient in jeopardy, just like our sandwich, right? Okay. What is the first thing your gloves should touch? The patient, not the supplies. Don't put your gloves on and get all those supplies ready. Get everything ready first and then your gloves. When do we wear gloves? If we don't wear them for everything, when do we need to wear gloves? Okay, so body fluids, personal skin, and non-intact skin. Very good. Very good. Once you've touched those areas, though, and your gloves are contaminated, what do we have to pay attention to? Yeah, what else do we touch? That's right. What are we spreading around? And then finally, we have to remove our soiled gloves correctly. So, glove can touch glove. What can't glove touch? Skin. That's right. So, we're going to pinch up and pull off inside out, bundle that up to keep control over it, and then go under. Right? So, pinch up and then under. Good? Questions? All right. We also learned when to use a privacy blanket. So why do we need privacy? But why isn't the curtain enough? Right. Curtain does nothing to protect the patient from you. Absolutely. And it also doesn't do anything to keep the patient warm. And remember, it's cold in our clinical settings. So when are we going to use a privacy blanket? Anytime the patient is uncovered or undressed. Very good. And when we put the privacy blanket on, what do we have to be careful not to do? Shake, snap, fluff, whatever you want to call it. Don't do this, right? But we want to put that privacy blanket on top of the sheet and pull the sheet down underneath. Why? That's right. It keeps them covered. If you just take the sheet all the way off the patient, they're not covered. Does that make sense? All right. And then when do we want to remove that privacy blanket? Before or after we take off our gloves? After we take off our gloves. That's right. And the reason is that when we take that privacy blanket off, you've got to pull that sheet right up next to the patient's face. And if you've got dirty gloves touching that sheet, it's going to be right near the patient's face. Remember, we have lots of holes here for pathogens to get into. Good? Good? All right, we also learned linen rule. Do you guys realize how much we've learned? Right. We've also learned linen rules. So the very first one we've heard before, right? Your linens cannot touch your uniform. So if it shows up on two principles, it's probably pretty important, right? Let me tell you something about this. I'm old enough to have seen this transition. It used to be a million years ago that people that worked in acute care settings, remember hospitals are where we take all the big germs, the bad germs, the ones that are bad enough to keep somebody from being at their home, right? So the worst germs in our neighborhood are all in the hospital. Well, it used to be years ago that when you worked at the hospital, you didn't wear scrubs to work. You got to work and changed from normal clothing into scrubs. Took care of your patients, and then at the end of the day, you changed back into your normal clothing to go home, right? So you didn't wear scrubs to the neighborhood grocery store. Now, if you go into any big box store, probably about 10% of the people you see walking around are walking around in scrubs. I am guilty of this as well. I wear scrubs. I stop at the grocery store on my way home. Now, I'm not in clinical practice, but can you see that that might be a bit of an infection control problem, right? Especially when we know that once we start working, our scrubs aren't clean. Now, how do we know? Because every single checklist tells us not to hold clean supplies against our uniform. So we know the uniform is not clean once we start work. You see how that might be a problem? So what they did way back then, when they started allowing people to wear their own scrubs, they said, okay, that's all right. We can make that work. But once you leave here, you probably ought to cover those scrubs up so that you're not, if you stop at the grocery store, you're not shedding pathogens everywhere. And this is when scrub jackets were born, because they were specifically to cover up those contaminated clothes once you left the facility. Well, facilities are cold, so healthcare workers started wearing the jackets in the facility. And did that really help? Now we've got another layer of contamination. Doctors who worked in a doctor's office and then went to the hospital would put on a lab jacket when they got to the hospital, see their patients, again, to minimize contamination on their clothing, take that lab jacket off when they went back to their office, so they're not spreading hospital germs to their office patients. Made sense, right? Except that the doctors liked the way they looked in those lab jackets, so they wore them all the time. So are they really doing what they're supposed to do? So because of this, and I've seen this whole arc over my career, because of this, we now have to understand, this is why I have to teach you that your uniform is not clean. We've tried all different ways to try to keep your uniform from contaminating other people. We can't. So now we just say, don't touch any clean stuff against your uniform. That's the best we can do. I think we probably could do better, but I got to get everybody on board, and that's hard to do. All right. So we already know not to shake or fluff our linens. When we're going to put anything under the patient, whether it's a clean sheet or a chucks or anything like that, we have a way to remember how to do this. And that's clean rolls toward me, dirty rolls away. Yep. We don't want anything to touch the floor. Not clean stuff, not dirty stuff. Nothing touches the floor. If you use something, it goes directly in the hamper or on the chucks on the table, on the barrier on the table. Good. What happens if you get too many supplies and you don't use them all? Can you save them for later?
No.
Can you put it back?
No.
What do you do with them?
Put them in the dirty linens.
Dirty linens. Good job. Look how smart you guys are. You didn't know any of this 2 weeks ago. Think about that. You didn't know any of this 2 weeks. If I had given you a quiz 2 weeks ago, you wouldn't have a clue. Look how far you've come, and I'm only half done with you. All right. We also learned how to keep our patients safe in bed. Where does a patient always need to be? In the middle of the bed. Now, patients do this on their own without our help most of the time, but if we have to help them, there's a specific way we're going to do this. We're going to scoot them toward us first and then roll them. Which way do we roll them? Toward us or away? Away. Why? Right? So modesty, right? We don't want them to be eye level with our crotch. That's a big reason why we don't want to turn patients toward us. Is there a safety reason? Why? Right, because gravity is going to pull them back onto their back, and we want to try to prevent that. If they're too far away, we can't prevent that. Does that make sense? Good. All right, so when we're doing this, we're going to scoot the patient toward us and then roll them away, and we must remain behind their behind. Yep. All right, good. Now, I just watched a video this morning on sideline position by another company. That the video quality is excellent, man, perfect. I love the quality of their videos. The content, not so much. She rolled the patient. First of all, she didn't prep the patient at all to roll them. Just had them put their foot on the bed, and then she rolled the patient toward her, right, which is the wrong way. And then she reached across the patient to try to tuck a pillow along their back, and the pillow was not in a roll. Well, it's because she's on the wrong side. You have to be behind the patient to put that pillow in a roll behind the back. So remember that we always remain behind the patient's behind. Good? All right. We also learned how to wash stuff. Man, we've learned a lot. We learned how to wash stuff. What do we not put in the basin? Soap. Why? Why can't we put soap in the basin? Because whatever we wash, we have to rinse. Yeah, whatever we wash, we have to rinse. So if we have to rinse something, we got to have water for rinsing. If you put soap in the water, you have no rinsing water, right? So basins are no soap zones. When we get water to use to bathe a patient, any body part, foot care, hand care, partial bed bath, peri care, catheter care, pick your care, we have to take that basin to the sink and put water in it. Let me tell you a story about this. There is actually a checkpoint that says use basin for water for bathing. Now, why do you think that that's a checkpoint? Use basin for water for bathing. Why would that possibly? I mean, it's kind of a no-brainer. Why did they have to put it in the checklist? Well, it's because students would go over to the sink, wet the washcloth, bring it back over to the patient, and try to bathe them and constantly go back and forth. Well, every time they do, they're touching the faucet. What do we know about that faucet? Yeah, and our hands are. So when we go get water, can we just touch the faucet to turn it on? What do we need to do? Use a paper towel. Very good. We also need to make sure that the water temperature is comfortable. So we're going to use the inside of our wrist. How should that water feel to us? Warm, not hot, not cold, just warm. But that takes a little bit of time, right? So if you don't have a basin for water and you walk over there and you use a paper towel, turn the faucet on, now we got to wait for the warm water, get our washcloth wet, come over here, take care of the patient, go back over there to get a rinsing water. I mean, that's a whole lot of time, but it's also a lot of possible contamination that can happen in that chain. Does that make sense? So yeah, some of these checkpoints are like, who would do that? Of course you're going to use a basin for cleaning, but the checklist is written so that clear expectations are outlined. Okay. So who else needs to check the water temperature? Always, every time, always. And then if we're going to wash any wet body openings, this was eyes, nose, mouth, genitals, rectal area, wounds, rashes, sores, or incisions, right? A lot of body openings. We're going to use a special type of cleaning process called the leaves method, right? Where we held the washcloth. I'm sorry. We're doing that today. I'm going to teach you that today. So every time that we wash a wet body opening, we need a special process, which we're going to learn. Whatever we wash, we need to, whatever we rinse, we need to dry. Try not to get your surface wet. So we're going to protect the table with a barrier, the bed with a towel or a chucks if we're working a little lower. And if we have to apply lotion, what do we need to do first? And what do we need to do after? Wipe off the excess. Good. Very good. And then we have to clean. So anytime we wash a body, we have to clean the basin. Now, remember, in most cases, that basin is just going to hold water, clean water. We didn't add soap to it. No dirty washcloths went back in it. So it's just water. Where do you dump water? In the sink. If we're emptying a bedpan, where would that go? Yeah, we're going to put the body substance where it normally goes, right? So you don't, if you're bathing a foot, you don't need to put that in the toilet. It's water. If you want to, it's fine, but it's not required. Okay. So we're going to empty the basin wherever it normally goes, sink, toilet, whatever. We're going to rinse that basin and we're going to put that rinsed water where we put the body substance, right? Whatever we dumped. If we have to disinfect it, we're going to do it once the basin is sitting in the sink. Once we've disinfected, though, we can't touch it with our dirty gloves. So we need a paper towel to pick it up, paper towel to dry the inside, throw that away. Different paper towel to dry the outside. Now, the reason we're using two separate paper towels here is because the bottom of the basin was not disinfected. Make sense? Two separate paper towels. And then we're going to store the basin. So for the test, all we do is rinse, dry, and store everything. That's it. We're not disinfecting anything. Rinse, dry, store is perfectly acceptable, just like your sink at home. But when we want to go put that item away, whether it's a bath basin, an emesis basin, a bedpan, a graduate container, whatever we're working with, when we go put it away, can we touch that drawer with our dirty gloves or dirty hands? So what do we need? A paper towel. So you're starting to realize that infection control aspect of this, right? We have to be aware of when things are clean and when things are dirty. And then every skill ends the same way. So we want to make sure the patient is in a clean environment because they'll rest better. So look around. Make sure your patient looks better than you left them. That's just a really good principle, right? So I always try to arrange the sheets, make sure the environment's nice and clean, things are stacked neatly. Leave your patient looking better than you found them. What position does the bed need to be in? Lowest position. And that is a graded checkpoint on every single skill. Now you can, if you want to, raise the bed up to a comfortable working height. So I can do this. I can raise this bed up to a comfortable working height. Those of you at home, you can only see a little bit of the bed. But this goes like way high, right? So any skill that I do, I can raise that bed if I want to. But if I raise that bed and at the end of the skill, because I'm in a hurry and my brain took off on vacation and I'm not thinking clearly, chances are I might forget to lower that bed at the end of the skill because I get on a roll and I'm just trying to get to my skill is done, right? So I may potentially fail the skill if I forget to lower the bed. That is a safety step and counts big. Okay, so bed height has to be in the lowest position. Take a moment to make sure. We have to ask the patient a very specific question. Are you comfortable? They need to hear that word. Are you comfortable? And you can offer a magazine if you want to. That's fine. That just helps with emotional comfort. You can also give them their TV remote or whatever. You can ask them if they want the curtain left open or closed, or you can just open the curtain. Either way is fine for the test. But at the very end of every skill, we have to make sure that they have an item before we leave the bedside. What do they need? Call light. And the checkpoint very specifically says in or near hand. In or near hand. So ultimately, it's probably best for the test to make sure you put that call light in their hand and tell them to use it. Okay. Chair skills are a little bit different because the patient is not in bed. They're in a chair. So for chair skills, the call light just needs to be on the bed in reach. Okay. But if they're in bed, put the call light in their hand. Best practice. After we've done all that, we're probably going to open the curtain or ask them if they want the curtain open. And then the last thing that we're going to do after we've done all that is go clean our hands because we need to rid ourselves of those patient cooties, right? Get rid of those cooties. So if we clean our hands, what can we not do afterwards? Yeah, absolutely. Absolutely. Because if you go back to the patient and give them their call light, then you've recontaminated. You missed the whole point of washing your hands. Make sense? Good. So the checkpoint is end skill with clean hands. End. That means the very next action is my skill is done, right? End skill with clean hands. Now, documentation has to come in there somewhere, though, right? So if we have to document, remember we have 4 documentation skills: pulse, respirations, feeding, and drainage bag. You will get one of those 4. Everybody gets a documentation skill. So if we have to document, we're going to do that after we've washed our hands, because we only want to touch our pen with clean hands. And then we have to wash our hands again, because end skill with clean hands. Good? Okay. Can you make corrections on the test? Okay. When can you make corrections on the test? Anytime. Anytime. They may need to see it. They may, allow just a verbal correction. Go by their instructions. Usually they're going to need to see it, especially if it's an action. But you can make corrections. All right. Any questions on all of that? I'm not going to go through these. There's a lot of them. All right. So let's go to page 55 in your skills book. All right. So this care plan at the top of page 55. Let me get my camera thing. Oh, Caitlin, thank you. There we go. All right. Okay, so our care plan at the top of the page says to provide the following range of motion exercise to the resident's right elbow and right wrist, flexion extension. Provide 3 repetitions of each exercise, and the resident is not able to help with the exercises. So let's break this down little by little. First of all, it tells us to perform range of motion to the resident's right elbow and right wrist. Can we do the left too? No. It tells us to do flexion extension. What about abduction, adduction? What about rotation? Can I do them to get extra credit? No. Won't they be impressed with how much I know? No. What are they really grading me on here? Following the rules, following the care plan. Provide 3 repetitions of each exercise, and the resident is not able to help with the exercises, which means that this is passive range of motion. And you can see that there in the gray box, passive range of motion. Oh, thank you, Jocks. That's sweet. This class is helping me a lot. Aw. Oops. All right, Caitlin, I'll let you do it. All right, so there we go. This class is helping. Oh, what a cute little one. Okay, so this skill is the quickest skill that we have. It is literally opening, exercise on the elbow, exercise on the wrist, closing. You're going to spend 90% of this skill doing your opening and closing. Okay, but let's look at these 2 exercises. So flexion extension of the elbow. Your elbow only goes in one direction. That's it. That's all it will ever do. It can only go up and down. If you get an elbow to do something other than this, you have broken it. Okay, so there is no abduction, adduction on an elbow. There's no rotation on an elbow. It is a hinge joint, up, down. That's all we get. Good? Okay. But the wrist can move in lots of different directions. Your wrist can move up and down, like revving a motorcycle. But your wrist can also go side to side. Now, this isn't really much of a side to side action because it's actually, this side to side is actually happening here, not here, right? So in order to do a abduction, adduction of the wrist, we're not doing it for this care plan, but let me show you how to do it for a wrist. Can I borrow your wrist real quick? Come on up here. Yep. So if I needed to do abduction, adduction on her wrist, I would hold her hand upright. Just relax for me. I'm going to hold the wrist with one hand, hold the palm of the hand with the other, and do this. Do you feel that in your wrist? That's way different than doing this, isn't it? Okay, good. So when you're doing abduction, adduction of the palm of the hand at the wrist, you have to hold the wrist in place to keep it stationary. Good. And then a rotation motion of the wrist is a magic wand. Bippity boppity boo, right? You just spin it around. Extra credit if you go that way. Okay. All right. So that is how we would do abduction, adduction, and rotation of the wrist. But this care plan just tells us to do flexion extension. So we do an opening, we do flexion extension of the elbow, we do flexion extension of the wrist, and we do a closing. That's the whole skill. Super quick and easy. When we are doing range of motion, there's a couple of things that we want to remember here. We're going to lift from below. Okay. We always return to start. It has to be a complete range of motion. Always return to your starting position. You want to support at 2 joints. Now, for this one of the joints is actually going to be on the bed. The elbow will always remain on the bed. So if the patient's laying in bed, their arm is stretched out. When we bend that elbow up, that elbow stays on the bed. It's just the forearm that comes up. So we want to support that. And then when we do flexion extension on the wrist, we're going to elevate that wrist so we don't have to bend. And we're going to keep that elbow on the bed while we flex and extend. So the elbow is always supported by the bed for the skill. Okay. And then, of course, we want to monitor for pain. That's important. Monitoring for pain. What do we do if we get pain? Tell the nurse. Yeah. Do we tell the patient, oh, come on, push through it. You'll be fine. No, you're building muscle. No, we're not going to do that. All right, so here are our checkpoints for this particular skill. We want to lift extremities from below with a flat palm, provide 2 points of support, move slowly and smoothly, return all the way to the start position. Remember, flex extension is up, down, abduction, adduction is side to side, and rotation is around. It's everything you need to know for this skill. Good? Questions? Need a volunteer. Somebody go lay down in that bed over there. Somebody, that one. Somebody, anybody. So I need to move that real quick. Hold on one second here. Oh, that'll work. Okay. All right, here we go. Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you? Great. I need to do some exercises on your right elbow and wrist. Is that okay? I'm going to close your curtain. Let me go wash my hands, get my supplies. I'll be right back. This is my first skill. First one that's on my care plan. So I physically have to go to the sink and really, for real, Wash my hands with soap and water at the beginning and the end of this skill. After this skill, the evaluator is going to tell me I can simulate hand washing for the rest of the test. So I'm going to come over here and turn the faucet on. It should feel warm, not hot, not cold, just warm. Do me a favor. Can you go up? You see where that red light is on the bottom row? Can you hit number 3 for me? Right next to it? Just hit number 3. There you go. Oh, good enough. All right. So I'm going to wet my hands. I'm going to get some soap. Yep. I'm going to start rubbing them together. And I'm going to look at the clock. I want to rub the tops of the wrists, the backs of the hands, in between my fingers, in between my thumb and index finger, the bottom of my hand by my pinky, and the palm of my hand. I want to wash, come around here, maybe that's better. I want to wash all surfaces. Where did I go? Yeah.
There looks like a split in the middle.
Yeah, that's weird. Okay. Well, I'm going to wash all of my hands. For how long? 20 seconds. And then I'm going to go down each one of my fingernails to get them clean. And I'm going to circle my nails on the palm of my hand. That is weird. And then I'm going to rinse. And then I'm going to tap to keep the water safely in the sink. I'll get whatever paper towels I need to dry. Throw those away. And then turn my faucet off with a clean, dry paper towel. Now, can you hit 2 one more time, please? Okay. So now, through the magic of Hollywood, I am back at the bed. And I am going to do some exercises on your right elbow and wrist. Your job is to let me know if there's any pain or discomfort as we do this, but I'll do the work, okay? First thing I'm going to do is bring your arm up to your shoulder and back down to the bed like you're making a muscle, okay? So we're going to go palm up, bend the arm up, and all the way back down to the bed. Feel okay? Up, all the way back down to the bed. Still good? One more. Up and all the way back down to the bed. Now, I could raise the bed up to a comfortable working height so I don't have to bend. That's fine. But that was all of about 10 seconds. It's going to take me longer to raise the bed. Now I'm going to work on the wrist. So I'm going to bend your arm up, keep the elbow on the bed. We're going to make a loose fist, and I'm going to bend your hand forward and back like you're revving a motorcycle. So forward and back 1. Feel okay? Forward and all. You want to go all the way back, okay, till we meet resistance. 2, and forward and back 3. Good? Are you comfortable?
Yes.
Is there anything else I can get for you while I'm here? Would you like a magazine before I go? Okay, open the curtain. I'm going to look around and make sure. Let me go ahead and get you to lift your feet up. Make sure that my patient looks good. So we'll go ahead and cover you up because you are in bed. Okay, and the call light is right here. So I'm going to put that in your hand. If you need anything at all, just press that red button, okay? All right, my environment is clean, so I'm going to go wash my hands. So where's all my time spent for this skill? Here, yeah. So I'm going to open the faucet, wet my hands, apply some soap, start to rub, look at the clock. I'm going to rub the tops of the wrists, the backs of the hands, and in between my fingers, in between my thumb and index finger, the bottom of my hand by my pinky, the palm of my hands, interlacing my fingers, all areas for how long? And that is 20 seconds. I'm going to come down each one of my fingers to clean my cuticles. Sorry, guys at home, my camera's not working. And then I'm going to rinse. When I rinse, I want to make sure I'm not touching the sink or the faucet. And then I'm going to tap to keep the water safely in the sink. I'll get some paper towels, dry all areas that are clean. and then turn my faucet off with a clean, dry paper towel. Now, I probably want to read that care plan one more time just to make sure I did it all properly. And you can go ahead. And if I did it properly, there we go. If I did it properly, then I can tell the evaluator my skill is done. But let's say I did that whole skill. And I came back over and I looked at my care plan and I realized that I did it on her left elbow and wrist. What did our care plan say? Right. So if I read that care plan and I stopped and thought about it and thought, oh no, I did the wrong side, I could say correction. I would have done exactly what I did, but on the left side.
Will they still take that?
They will. Yeah. Now, what you can't say is correction. I would have done flexion extension of the wrist too. They need to see that. Good? Makes sense? Good. All right. Thank you very much for being a camera operator. All right, so let's move on to provide mouth care to a resident with dentures. This is going to be on page 68. Okay. So this care plan on page 68 tells us up here, a resident with dentures is sitting at an overbed table with their dentures in a denture cup. Where are the dentures at? Are you going to be taking dentures out? No, because where are they? In a denture cup. Do not put your hands in somebody's mouth and try to remove their teeth for the test. If you look at the bottom of the page, you'll see this is going to be done on another testing student. Most of you do not have dentures to take out, right? So where are the dentures? In a cup. I'll tell you more about that in a minute. It says the resident's denture needs to be brushed with toothpaste and the resident needs mouth care. The denture is stored in a denture cup after cleaning. Where are we putting that denture? Back in the cup. Are you putting it in somebody's mouth? No. How do we know that? The care plan. And what do we do with the care plan? We follow it. Starting to see that? All right. The resident is not able to provide their own mouth or denture care. That's pretty, pretty self-explanatory there. But let me explain something to you regarding dentures. CNAs do not take dentures out. We do not put dentures in. That has to be done by the patient. If the patient cannot take their own dentures out or put their own dentures in, we don't use dentures. We just puree their food really fine so they don't have to chew, right? There's actually a diet called mechanical soft. And if they need it even further chopped up, it's pureed. Yeah. So we have processes for this. We do not put our hands in somebody's mouth to remove their dentures or to put them in. And let me explain why. If I have dentures in, particularly the bottom, okay, if I have dentures in on the bottom and I want to remove those dentures, I have to take my hands and put them way back in the back, way back here at the very back of my jaw and pop them up and forward. Okay, now I can do that on myself because the angle is right. But if I try to do that on you, if I put my fingers in your mouth to try to pop that bottom plate up, my knuckles have to press down on your jaw for leverage. And I risk dislocating your jaw by popping those dentures out if I'm not watching what I'm doing. Do CNAs ever cause pain? We shouldn't. We shouldn't. We should be doing normal. Remember normal, right? Routine tasks, stable patients, no pain. Not our job. Pain requires a bigger degree than what we have. So dislocating a patient's jaw, way out of our scope of practice. Way out of our scope of practice. So the patient has to be able to do this themselves. Dentures are usually held in with paste, which is sticky, stringy, gummy. It helps keep those dentures in place, but they're also held in place by suction. So these things are not easy to get out, and we end up putting a lot of downward force on that jaw. Good. Now putting in dentures, whole new problem. Bigger problem. Because when you put dentures in somebody's mouth, they have to, remember suction, right? And paste. They have to bite down to seat those dentures where they need to be. So when you pop a denture in somebody's mouth and try to get it in the right place, they're automatically going to bite down. They're not looking to see if your fingers are in the way. They're just going to try to get those dentures in place. And chances are you're going to end up bit. So we don't take dentures out. We don't put dentures in, not our job. Now, what if the patient can't do it on their own? Who would we tell? The nurse. So should we just go in there and start taking dentures out and putting them in by ourselves? No, we have to notify the nurse that there's an issue there. Good. Questions? All right. So this tells us our dentures are going to be stored in a denture cup at the end of the skill. So we get the dentures cleaned, put them in a cup. The cup is then stored on the bedside table so the patient can use it later. Dentures, once we clean them and rinse out that cup and fill it with water, are going to be wet. If I put a wet cup on a wooden surface, your grandma is going to scream because that's going to warp whatever surface we put it on. So if we have a wet cup, what should we put under it so that it doesn't ruin our furniture? A coaster, yeah, which we're going to use a paper towel for. Good? Right. Grandmas the world over are definitely fans of coasters. So when we put the cup back, either on the patient's overbed table or the bedside table, doesn't matter where you put it, whatever the patient wants. When we put it back, we want to put it on a barrier. Good? Dentures always have to be in water. They dry out if they're not, and if they dry out, they become brittle and break. Dentures are expensive. A set of dentures is about the same price as a good used car. They're expensive. Yeah. A couple $1,000s. Not unusual to be $5,000 or $6,000 for dentures. So do we want to go around breaking our patients' dentures? No. This is the big deal with this particular skill, is the steps that we're going to take to prevent from breaking the dentures. That's the main focus of this skill. Make sense? All right, when we clean dentures, there's two different ways we can clean. Let's come back to this slide in a minute. Okay, there's two different ways that we can clean dentures. The most common method is to put the denture, rinse them off, put them to soak in a denture cup with those 2 fizzy tablets, right? And that the fizzy tablets gets in there, it breaks down that denture paste, it breaks down the food particles, it actually denaturizes the proteins. Proteins make things sticky. So if we can denature those proteins, we can remove all the food particles. So these things work pretty good. And then when you take them out in the morning, you just rinse them off. Maybe a light brush if you need to, but it works pretty well. Most dentures are going to be cleaned with denture tablets. Most people will tell you, do not brush my dentures with toothpaste. Toothpaste is abrasive. It'll actually cause microcracks to form in those dentures. And if you have microcracks, those are great places for pathogens to hide because it's warm, dark, moist, right? Great location. Every pathogen loves a nice cracked denture to climb into. So we don't want to use something abrasive on the dentures. Does that make sense? Unless our care plan tells us to. So let's go back a second and look at that care plan, because it's going to tell us how to clean these dentures. And the care plan says needs to be brushed with toothpaste. So we're going there. We're doing it. And the reason that the test is making us do, well, first of all, we don't need to watch you put fizzy tablets in a cup of water. I mean, really, that's not a skill, right? The reason that they're having us do this is because we have to prove that we can do this without breaking the dentures. And that's what this skill really is all about. Good. Now, anytime that we're touching dentures of any kind, what do you think we need to have?
Gloves.
Gloves. I thought I had gloves over here. I do not. Yeah, I'll get those. So anytime, oh, there's my gloves. Okay. Anytime that we're going to touch dentures, we need some gloves. So I'm going to get a pair of gloves here to show you the dentures, because we don't want to touch them. All right, so the first thing I'm going to do is put my gloves on. And when I take the dentures out of the cup, they're going to be in water, because remember, dentures have to be stored in water. So when I take the dentures out, they're going to be a little bit wet, which means that we have to be super careful not to drop them. Okay. There's a couple different types of dentures. Go here. A couple different types of dentures. This is the one that most of you guys are familiar with when we talk about dentures. This is, try to get all the water off so it doesn't drip on me. This is a full plate of dentures. So every tooth has been removed, and this is replacing all of the patient's teeth on the top. I know it's top because it has a palate. Bottom dentures have a cutout here for your tongue. So I know this is top, so it would go in just like this up against the roof of the mouth. And we would probably put a little bit of denture paste in here to help hold the dentures in place, depending on what the patient prefers. But this is a top plate. This is what most people think of when we talk about dentures, okay? But that's not the only kind of dentures there are. We also have partials. So this is a bottom plate. You can tell because it has a cutout for the tongue, right? No palate there. This is a bottom plate. And when you look at this, you can see that there's a wire ring here to fit around a tooth that is there, that's still in the patient's mouth. There's teeth that we have replaced. And then there are cutouts for teeth that are still there, right? Because if a patient has good teeth still left in their head, we're usually not pulling good teeth. We're going to work around them. So this is a partial. We're going to clean them both the same way, but you need to be aware that there are differences. Okay, a full plate and a partial. Now, partials are a little bit trickier to clean because usually they have some sort of a metal ring, and you've got to make sure you get around that ring pretty well. Okay, dentures are always stored in water. And then you've got bridges. Now, bridges are often implanted now. They're often permanent. They're put on a post, and they're permanently implanted. But sometimes you'll see bridges like this. They're little pieces of dentures with wire rings to help secure them around the teeth that remain. So full plates, partials, bridges, they're all cleaned the same way. Okay? Questions? In order to clean dentures, we're going to use a special cleaning brush. This is called a denture brush. Kind of looks like a short, stubby toothbrush, but double-sided. Now, the reason it's double-sided is because this end is smaller to fit in that channel or groove part of the dentures to get that denture paste out pretty well. This looks like a toothbrush, so we're going to use it on the teeth part of the dentures. So we're going to use this just like we use every other toothbrush. We're going to dip it in water first, put some toothpaste on it, and then we're going to use this end to brush the channel, this end to brush the teeth. Good? We're going to do this over the sink. All dentures are going to be cleaned over the sink. But we have wet dentures, which are slippery. We have toothpaste, which is slippery. And you got running water, which is trying to knock the dentures out of your hands. So the chances of you dropping this denture are pretty high. So we need to put something in the bottom of the sink to protect the dentures if they should fall. And we're going to use a washcloth for that. So we're going to get a washcloth, put it in the bottom of the sink. Now, if you can get that washcloth over the drain, that's even better because that's going to help the water kind of pool up and reduce the likelihood that our dentures are going to be damaged if they fall. We don't want to use that water for cleaning, though. We never want to take that denture and put it in sink water. That's pretty gross, right? That sink isn't clean. So we don't want to put the denture in that sink water. Our denture is only held under running water.
If you drop them, should you reclaim them?
I would, yeah, because that sink water is not clean. Then once we get the denture clean, we're going to rinse out our denture cup, put some water in it, drop our denture in there, and we're good to go. Good? Questions? Let's remember how to take our gloves off once they're soiled. Remember, we're going to pinch up here at the palm of the hand, pull that off inside out, wrap it up so that we have control. And then we're going to go underneath. Remember, we don't want to do this. Underneath to take that one off. And then we'll throw this away. Questions? Okay, so our care plan, I don't have it up there. Our care plan tells us the resident also needs mouth care. So we're going to clean the dentures over there at the sink, store them in water, on a coaster, bedside table. We're done with the dentures. But we also have to clean their mouth. This is mouth care. We already learned mouth care last week. We're just going to repeat it, mouth care. But instead of using a toothbrush, remember that your patient probably has denture paste on their gums. They may have some natural teeth still left in their mouth too, if they have a partial, but they definitely have some denture paste in there. If I try to use a toothbrush to get that denture paste off of the gums, that toothbrush is going to get all gummy, right? And it's not going to be effective after a few seconds. So we use something a little bit different. We use this. This is called a toothette or an oral swab. That's what this is called. And it's soft, it's spongy, but more importantly, it's solid. So I can use this in the mouth, swipe the denture paste away, turn it a quarter turn, swipe the denture paste, turn it a quarter turn. I have 4 surfaces to work with. I got 4 quadrants to the mouth. Works out perfect. Good. And if we have a lot of paste that we're dealing with, use 2. Okay. But you can use this just like a toothbrush. We're going to dip it in water, put a little toothpaste on it, and use it to clean whatever is in the patient's mouth. Gums, teeth, whatever they got, we can use this on. Questions?
So how do you use that? Like, so do you brush the patient's teeth if they still have like some teeth left?
Mm-hmm.
Or do you only use that?
No, we can use this to brush with.
So how do you get it good though with like?
Believe it or not, this does as good of a job as bristles do. Yeah, it does. You guys seen, totally off subject, but this was kind of neat to me. I like technology and technological advances and stuff. Have you guys seen the new toothbrush that's out? It's ultrasonic. Have you ever heard about an ultrasonic jewelry cleaner? Right? This is the same concept, but for your teeth. You just, it looks like, it actually looks like a denture. Okay. It looks like a whole plate and it has grooves on the top and grooves on the bottom. And you put some toothpaste in there, you pop it in your mouth and you turn it on and ultrasound waves cleans all of your teeth. And it does a really good job because it's ultrasound. It's actually able to get into all those little nooks and crannies that your toothbrush doesn't reach very effectively. Isn't that cool? Yeah, that's a really neat invention. So ultrasonic toothbrush. I saw that. I'm like, wow, that's really cool. They got lots of studies showing that it's effective. So I'm wondering if maybe toothbrushes are going to be replaced at some point in the future with a gadget like this.
And do they have like a specific process retainers too, or is it just like when you come to the situation?
So, yeah, you're going to follow your care plan for that specific patient, and it depends on the setting that you're in. So, let's say that you're working in a assisted living facility. There's not going to be any retainers anywhere there because our patients in assisted living aren't doing orthodontia, right? But if you, isn't it cool?
Yeah.
They're expensive.
Price, I'm like, Jesus.
Yeah, they're expensive. They, but you know, it's a new technology, so it will come down as more people enter the market. It will come down. I remember when electric toothbrushes became a thing, right? And everybody's like, "What do you need an electric tooth? You just brush. I mean, we don't need somebody to do this for us." And now, how many of you guys have an electric toothbrush? Right? They're common now. They sell them everywhere. So it's interesting to see the progress that we make, right? But to answer your question, it's if you're working in home care, particularly pediatric home care, you may have a retainer that, you know, because that's part of your patient population. So you would go by the care plan for that particular patient or ask the patient or their family, how do you normally care for this? Okay. Good question. Good question. It really depends on your patient population. All right. So the big takeaways for this particular skill, go back here. The things that we're going to focus on here is that we want to put a washcloth on the bottom of the sink. We're going to use cool water. Don't use hot water. Remember how I said proteins make things stickier? Well, heat makes proteins stickier. So we don't want to use hot water here. We're going to store the dentures and clean a cup of clean water on a barrier. We're going to do mouth care. Patient has to be sitting fully upright. We already know that. We'll protect the clothes. We already know that. We're going to brush all surfaces in their tongue. We already know that, but this time we're going to use a toothette rather than a toothbrush. We'll wet all brushes before we apply the toothpaste. We're going to allow the patient to rinse and spit, and we'll leave the face and clothing dry. So from here down, that's all mouth care. So there's not a whole lot here that we're going to add in other than cleaning the dentures. And we just want to stress safety and infection control. You need to have gloves on when you touch the dentures. You don't need gloves on to touch the cup though, right? Just the dentures. So at the beginning of this skill, the patient's going to be sitting in a chair at an overbed table with dentures and a cup on the table. So I'm going to go in and do my opening. Knock, knock, knock. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to do denture care. Is that okay? Close curtain. Now I got to go wash my hands, but I'm going to grab that denture cup on the way, take it over there with me and just drop it off. I'm not going to do anything with it. I'm just going to set it on the side of the sink. Drop it off. Wash my hands, get my supplies. So I start with a barrier first, and then I get the supplies that I need, put them on the barrier. I'm going to do my prep work. I'm going to wet my denture brush, put toothpaste on both sides, and I'm going to lay it in that emesis basin just to hold it. I'll take my emesis basin with my denture brush, my washcloth, and a set of gloves over to the sink. Okay. Once I get to the sink, I'll put the washcloth in. What's the first thing your gloves should touch? Patient, or in this case, the patient's teeth. Right? So I'm going to put the washcloth in the bottom of the sink, turn the faucet on cool or cold. Do I need a paper towel to turn that faucet on? My hands are clean.
Yeah.
Yes. And then when I'm ready to start brushing the dentures, I'll put my gloves on. That way my gloves don't accidentally get contaminated in all of that prep work. Once I get my gloves on, I'll open the cup, reach in, grab the dentures, brush the top, brush the bottom, rinse them, don't drop them, put them in a clean cup, cool water, put them on the table with a coaster underneath. Now that washcloth in the bottom of the sink, you're going to have to deal with sometime. We can't leave a washcloth in the bottom of the sink. So you can either take care of that before you start mouth care or after. It doesn't matter. Nobody cares as long as at the end of the skill, the washcloth got taken care of. Should we ever wring that washcloth out and throw it on the ground for later? No. Remember, that's a testing checkpoint. Everything goes straight in the trash or the hamper. Good. Now, I am going to show you the video for this one because it's got really good close-ups, and I think that will help you for this skill. All right, oops, over here. I think we finally figured something out.
Hello,
Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
I'm doing good. How about yourself?
Wonderful. I need to do denture care on you. Is that okay?
Yes.
I'm going to take your dentures to the sink. I'm going to close the privacy curtain and wash my hands. I'll be right back.
Okay.
Okay, Mr. Jones. I'm going to place a barrier on the table so we have a clean area to place the clean supplies. And then I'll gather the supplies that I need. We'll need a cup of water, a toothette, a denture brush, toothpaste, a basin, a washcloth and a towel, and 2 sets of gloves. Okay, we're going to get the denture brush ready for use, so I'll wet it and apply a little bit of toothpaste to both sides. We'll allow the basin to hold that denture brush until we're ready to use it. I'll be right back, Mr. Jones. I'm going to go clean your dentures.
Okay.
Okay, Mr. Jones, I'm just going to set your dentures over here so that you have them if you should need them later.
Okay.
I'll place the denture brush on the barrier, and now we'll remove these gloves. And we'll throw those away. Do you mind if I place a towel over your chest?
That's fine.
This will help keep your clothing clean.
Thank you.
We're going to prepare for the mouth care portion of this skill. We'll take the toothette and wet it. Apply a little bit of toothpaste to one area of the toothette and apply gloves. Okay, Mr. Jones, I'm going to brush all surfaces of your teeth now. So in a moment, I'll need you to open your mouth wide so that I can reach the back teeth.
Okay.
Okay, can you open your mouth? Thank you. I'm going to brush the back on the bottom and on the top, both sides. Okay, can you bring your teeth together, please? Thank you very much. We're going to throw the toothette away. And would you like to rinse? Very good. Would you like another rinse?
Yes, please.
Another rinse?
No, thank you.
Okay. I'm going to remove your towel and we'll place this in dirty linen. We'll throw away the disposables. And now I'm going to clean your basin. I'll be right back.
Okay.
I'll place the denture brush and the toothpaste in the basin and open the drawer with a paper towel to store the basin and other supplies. I'll remove the barrier from the table and we'll throw this away as well. Now I can remove my gloves. Mr. Jones, are you comfortable?
Yes, ma'am.
Can I get you a magazine?
No, thank you.
Is there anything else that you need?
No, thank you.
Your call light's right there. If you should need anything, just let me know. I'm going to open your curtain and go wash my hands.
Thank you.
After washing my hands, I'll think about the steps of my skill, make any corrections, and then tell the evaluator my skill is done. Okay, I'm still working on sound. It's better, not echoey, just too low. We're working on it. We got to step in the right direction though. That's good. All right, so let's go ahead and take our break. Come back at 1:45. We have 2 more skills to do, and you should have about a half-hour practice time today. I will. I am going to mute. Okay. I think we're muted, but still, be careful.
Why is that toothpaste with toothpaste in the dentures?
It is, but sometimes our patients are going to want toothpaste just because they like the clean, minty freshness of it. And sometimes they're on medications that we have to because the medications may influence the enzymes.
And if you don't want that, you just scrub it with water.
You use the fizzy tablets and rinse it out with water and a salt brush.
Look at that. That's adorable. Mm-hmm. Go ahead, dude. Oh my god, look how young he was. She really got her daughter just had to be shot, so she was able to change. Otherwise, her mom and dad is not connected, so she's been in that since they got Thank you. I was just saying, have you heard of the blue or not? Because you're looking for that. No. Because she's confidential, and I'm not supposed to be telling you anything. Because of the heat. Yahoo. Well, that's the no. Yes, you need it for the Oops, I was like, I have to submit a picture to help members that give me an ID badge with my picture. Oh. She was like, you know, you gotta send me pictures. I would have done Ocean City. I only got the 5 days to stay about it. I'm gonna come home at 11 p.m. and we'll only do it 3 days. I know, Auntie Sally loved it. That's true. Mm-hmm. I know. Well, you have to think about it. You got her. Yeah. I say, she didn't want to pay extra shipping. Mm-hmm. She thought it was so, she's making a big deal. Well, she didn't have to work if we stopped spending it all. And I'm like, look at her, I'm like, who's the one spending it? That's what I said. I go home and I go, he said, I bought 10 paper bags. Oh my God. Okay. That's your first thing? Good job. Mm-hmm. Too late, I could never do anything. Would that be enough? That'd be enough, plenty. More than enough for two. I'd have to download it. She does. She doesn't. She texts me this morning. Seriously? Yeah, I just drove all the way in with my ass. We stopped at like 3 states on the way home. Like did things. I went to a zoo in North Carolina. I went somewhere. Then she still texting me. Miss Shirley. It's a Parker bite. Yeah, I figured it. You want it out of the tongue. There you go. 78 page. This room really does have two temperatures, hot or cold. Yeah. Like there's no in between. What's better than one temperature hot? Yes. Right now, with the weather the way it is, I'll take cold any day. Mm-hmm. All right.
Okay. So we have a question here. Good morning. Are these skills pertaining to Prometric? Yes. They are exactly Prometric's testing checklists and care plan scenarios. They're still relevant for other states as well and other testing agencies. The scenarios just change a little bit, but these are specific to Prometric. So, Marsha, I hope that helps. And Jacques asks, when is the next live class? We go live every Mondays and Wednesdays from 9 a.m. till 1 p.m. Eastern time. We only have 3 classes left in this session. We have Wednesday, Monday, and Wednesday, and then you guys graduate. Yay! Super exciting. So 3 classes left in this section. The next session will start on 9/11. So that'll be the next. I know, what a date, right? And good afternoon to you, Bridget, as well. Okay. Moving right along. Everybody good?
I had a question about
Yes.
Do you hold them tightly or like
You don't have to hold them tight, but you definitely want to have a grip on them because you don't want them to fall. But holding them too tight sometimes will actually, cause you to yeah. So you want to hold them, how do I put this? Securely, but not tightly.
You said we're able to come to your class a month after.
Right. So when I say that, on the back of your ID badge, if you look at the bottom, you'll see practice room, Mondays and Wednesdays, 1:30 until 4. So while you're enrolled in the class, so can you guys hear me? I hope you can hear me. Am I unmuted? Okay. So when you're in class, you have this room available to you till 4. Okay. So you come in at 9. You can stay till 4 if you want to. You can go get lunch and come back if you want to. You can go away and do something and come back at 3 if you want to. The room is open until 4 for you guys to be able to practice. Now, after graduation, I don't let you in until 1:30. Class ends at 1, but you guys can't come in and practice after graduation until 1:30. And that's because I have another class. Can you imagine how awkward it would be on day 1 when you guys are already nervous and you don't know what's going on and you don't know what to expect? And at 1 o'clock, there's a line of people out there waiting to get in. It would be a little weird, right? And it would kind of feel like you were getting pushed out. So I do that. I give that half-hour buffer so that my current class doesn't feel rushed. So you guys are benefiting from that right now. On Mondays and Wednesdays, I actually have people that come in and practice. The last class comes in and practices, several of them, because their tests are coming up soon. But I don't let them in until 1:30. You guys are all gone, so you don't see them. And that's just that buffer is there so you guys don't feel pressured. Once you graduate, you will be the pressurers. So I have to give the new class some time. Good? So while you're enrolled, from 9 a.m. till 4 p.m., the room is yours. Once you graduate, you can't come in until 1:30. Okay? And that's just on Mondays and Wednesdays, no other days. Because I do other things in the classroom on other days. Okay? Actually going to start doing the videos probably next week or the week after.
Go ahead.
When are you going to start your CPR?
That is supposed to be on Friday. It's supposed to be on Friday. I've been so deep in the book that I am not really ready for it, but I can teach it. So how many of you guys would be interested? Let me ask this. Let me gauge interest. How many of you guys would be interested if I did a CPR class on Friday? How many guys? Oh, okay. All right. Well, we'll have a CPR class on Friday at 9.
You said if you already have your CPR, you have to get another one if it was just for like preschool daycare.
It depends. Some places will probably take that, but most places are going to want what we call BLS, which is CPR for healthcare providers.
Okay.
It's not really community CPR because we have more toys to play with.
Okay.
So you have to learn how to use the toys.
And how many classes does it take to get
One.
certified? Okay.
Yeah, it's 4 hours. You'll be here 9 to 1. It actually doesn't take quite 4 hours. I have to budget 4 hours. We'll probably be out of here within 3.
And will you be doing them every Friday?
No, I will be doing them probably right now twice a month.
Okay.
Right now, twice a month. So probably toward the end of August will be my next one.
So are you starting this Friday? Or
I will. Yeah, I will have classes Friday.
is there a payment or a list that we have to?
Yeah, I have to add it to my system so I can ring people up because, like I said, I've been focused so much on this book. I haven't really done much with CPR. So let me add it to my system. It is normally $55 for my students, my currently enrolled students. I'm going to be offering it for $45. So if you take CPR with me when you're in class, you're going to get a little bit of a discount. If it's after, then you'll pay the $55. Does that sound fair?
Yes.
Okay. So yeah, I will have. I'll have one on Friday at 9. Yeah. So, Caitlin, if you're listening, make a note. Friday at 9, and tell me send me a message after class and tell me to add it in the system so we can ring people up. So Friday at 9 CPR, and I'll just do it for you guys. I'll put a note up front just in case anybody else wants to show up.
So if we come on Friday, would we come here first?
Just come here.
Okay.
Yeah.
And you
You don't have to be in uniform. Yeah, CPR doesn't require that. Just come here, and I'm only limited to like 7 people. I can, so whoever comes, just come, and I'll work it out. I'll work it out. But just come to this class at 9 because they won't be open.
Right. Okay.
Come to this class, and because I've got all of you in my system, I can just send you an invoice through email, and you can click on it and pay it.
Okay.
Perfect.
So that'll be the easiest way of handling it. Because I've already got you. You're here. I've already got you in my system. So I'll have you sign in. I'll click, you'll pay that day before we get started, and then we'll get started. But yeah, CPR is super easy. It's like way easier than what I'm teaching you now. Way easier. Basically, you got to learn how to thump on the chest. You got to learn how often to squeeze the bag, for breathing. If we don't have a bag, you got to know what to do. And you have to learn how to use an AED. We also want to talk a little bit about choking. What to do if somebody's choking. And
how the whole process works. So it's and then you practice. That's all you do. You practice, and I watch you practice, and I help you. Hey, press a little harder, keep those elbows straight, a little faster. I just kind of practice. That's it. There is a test, but it's not a test. It's open note. It's not a test.
It's usually done with the whole class. Everybody
Yes,
answering.
it's not a test. So it's just open note. It just wants to make sure. So here's the thing about CPR, and then we'll get back to CNA because we got a lot to go over. Here's the thing about CPR. The whole purpose of CPR is to keep you from panicking. That's it. That is the whole purpose of CPR, is to keep you from panicking. Because if you don't have a clue what to do, and there's a dead body at your feet, what are you going to do? Panic. And then nothing gets done. So if you have very defined steps, okay, step 1, figure out if there's a problem. If there's a dead body at your feet, do you have a problem?
Yeah.
Okay, we got a problem. Hey, that's a good place to start. Step 2, let's call somebody who cares. Right? 911. Yeah, they care. We don't want to be doing this by ourselves. Right? We need a team. I need a team. I can't do this all alone. So find out if there's a problem. Make sure you're seen as safe, right? You don't want to get jumped in to shark-infested waters, right? Make sure you're seen as safe. Call somebody who cares. And then start circulating blood by pressing on the chest. That's all we're doing. CPR does not bring people back from the dead. That's kind of a misnomer. We'll go over that on Friday. CPR does not bring people back from the dead. All CPR does is circulate the blood to get oxygen to the cells until somebody else comes along with better toys that can bring them back from the dead. That's all we're doing, is circulating blood by doing chest compressions. That's it. So CPR, not nearly as scary as everybody tries to make it out to be.
But it does save lives.
It saves lives. It just doesn't bring anybody back, right? We have to get the people in the truck that has the better toys to bring them back. All we're going to do is circulate that oxygen. And if we circulate the oxygen long enough, we start to run out of it. So what do we need to do? Put some more in. So we'll breathe for them. So we're either going to breathe into their mouth or we're going to use a bag, right? But we're just going to throw some more oxygen in, and then we're going to circulate that. And as that starts to run out, we need some more. So we'll give them some more breaths, and then we'll circulate again. That's it. That's CPR. That's all you're doing is putting oxygen in and circulating it, putting it in and circulating it, putting it in and circulating it, putting it over and over and over again until somebody else shows up that can do something a little bit more. That's CPR. But the whole point is, don't panic. Don't panic. Find out, do we have a problem? Is the scene safe? And then call somebody who cares. And then start circulating some blood. That's it. That's CPR. So there you go. 4-hour class, 3 minutes. I'm going to show you how. I'm going to show you some videos because American Heart says I have to show you the videos. And we'll watch the videos. But it saves lives. 100% saves lives. But it's not nearly as complex as people think it is. It's basically helping you not panic. If you know what to do, just like the test. If you have a starting point, you won't panic, or you can overcome your panic. Okay? So yeah, I'm going to make it super easy, super simple, break it down just like that, and then we'll learn how to do CPR. Because there is a way to circulate the blood that's effective, and then there's a way that's not so effective. So we want to learn the right way. Okay? Good? All right. Hands only CPR does work as well. All right, so before we go on to ambulate with a gait belt, I want to talk to you a little bit about bed position. Go to page 104. So we talked a little bit about this on the last skill, but I do want to, or on the first skill we did today, but I do want to kind of go over this a little bit with you guys. Bed position, what goes up must come down. But when we talk about bed position, it's important to note that there are 2 types of bed position, and we have to be specific. So bed position, that term, means the entire bed. So this is what we looked at earlier today. So this is what we looked at earlier today, right? So bed position, When we talk about bed position, we're talking about the entire bed, this whole thing going up. Right, if we put it up, what do we have to do at the end? Put it back down. All right, so let's put it back down. This one moves a lot quicker than that one over there. That's a crank bed. Do you see the crank at the bottom? Yeah, that's manual labor. It takes a little bit of time to crank it up.
They don't have those no more, do they?
Yeah, they do. Long-term care settings still use those types of beds. But that's not the only adjustment of this bed. We can also put the head of the bed up. So the head of the bed goes up. Now with this bed, the foot of the bed goes up too to keep the patient kind of centered so they don't slide out. But the head of the bed can go up. This, at the end of the scale, is patient comfort. So the entire bed needs to be in the low position at the end of the scale. Head of the bed, it's whatever the patient wants. So when we're dressing a resident, we put the head of the bed up to put their shirt on. It's whatever they want. If they want to stay sitting up, they can sit up. If they want to lay down, they can lay down. Whatever they want, we'll do, unless the care plan says otherwise. Good? You know, there's a medication that we give, particularly older women. It's for osteoporosis. But there's a medication that we give women that they have to stay sitting up for 2 hours after they take the medication. So that care plan is going to say patient must be in a sitting position or upright position from 7 a.m. to 9 a.m. because we give it at 7. So in that case, we don't want to put the head of the bed down. So we have to make sure that we're following the care plan. Got it? Makes sense?
For the test, they'll always,
For the test, it's all
lowest.
comfort.
Oh.
All comfort.
okay.
Whatever the patient wants at the end of the scale.
But
Now-
the bed itself has to be all the way to the lowest. And then
Bed
you
of
can put the head up.
Yeah, the bed has to be in the lowest position. Head of the bed is comfort.
Okay.
Good? Do you guys understand the different bed adjustments? Entire bed low, head of the bed comfort. Okay. Now this bed is unusual because if I put the head of the bed all the way down, the legs stay elevated. See how the leg automatically adjusts when you put the head of the bed up, but it didn't adjust when we put the head of the bed down. So there's a button here on the bottom, and I'll have to show you guys this, but there's a button here that says flat. So instead of putting the head of the bed down for this skill, if you hit the flat button, it flattens everything. A little easier. Okay? Good? Does that help? Does that help? All right. So moving on. Page 46. How do we know what to do with each patient? Care plan. Our care plan at the top of the page. Oops. Let me change my view here. Care plan at the top of the page tells us to ambulate the resident at least 10 steps. Guys, please remember this is a round trip. 5 steps in one direction, turn around, 5 steps back gives you your 10 steps. You can walk them further. I mean, it says at least 10 steps. So a little further is fine. But for the test, don't make this a, million-mile march, okay? This is just to show that we understand the body mechanics and the safety involved in this skill. For the test, they usually will give you some sort of a destination. They'll say, walk to the corner of that table and back, or walk to the desk and back. They're going to give you a destination just to try to keep you from roaming around the room for a half hour. So at least 10 steps. It says use a gait belt or transfer belt. Patient will be sitting in chair at the side of bed with shoes on. Now, remember that we learned that slipper socks are not enough. We have to have shoes on. For this skill, patient's already going to have them, but we definitely want to mention, I see you have shoes on, or are your shoes fastened appropriately, or something along those lines, just to note that we understand shoes, right? Patient's able to walk, but needs assistance to stand. So we're going to use the gait belt to help them to a standing position, but they can walk on their own. So If you are the patient for this, because if you look at the bottom of the page, you'll see that this is a live student skill. If you are a patient for this, you're going to be you. Walk like you walk. Okay, we're going to walk. And we're going to turn around and we're going to walk. Right? We're not going to be a 90-year-old invalid here and we want to walk like we walk. If you try to ham it up for the test, they're going to yell at you. I mean, they don't yell, but you know, they're going to say, hey, walk like you walk. So save yourself some stress there. Now, for the test, sometimes some of these evaluators will throw you a little curveball. And I want you to be aware of this. If you look at number 4, step number 4 here, it says wash hands, gather supplies, and then there's a statement there that you don't see with any other skill. It says make sure walkway is free of obstructions. Because sometimes some of these evaluators, now remember, I just did a deep dive into the whole testing checklist, right? There's nothing on the testing checklist about this. So some of these evaluators go a little rogue and try to make this skill a little more complex than they should. And they will put a table in the walkway, put the patient in a chair here, and then tell you, okay, go ahead and start. I want you to walk to the corner of that table and back. So you need to pay attention to the fact that there is something in your way, and they did it on purpose to make sure that you're going to move that table before you stand the patient up and walk. Because if you wait, if you keep that table there, and I got to walk to that corner, and that table is in my way, and I stand the patient up and we start walking and the table's in my way, in order to move that table, where is my attention? Where should it be? There's a problem there. That's what they're grading you on. That's what they're checking here is, did you make sure your walkway is free of obstructions so that during the entire skill, your focus is on the patient? And that's because patients don't just walk along, I'm good, everything's fine, perfect. Ugh. They don't do that. They give us signs that something is going very wrong in their life. They will get pale. They might get sweaty. They could turn red in the face. They might put their hand out against the wall. That tells you they're unsteady. They may put their hand up here because they're dizzy. They may put their hand here because they're nauseous. They may start to sway a little bit. They may start to slow down. They are telling you in a million different ways that something is very wrong. And if you're focused on the table, you're going to miss all of those signs. And I can't tell you how many times in my career that CNAs have said, oh, we were walking along fine, and the next thing I know, she's on the floor. Well, that's because you didn't pay attention. Your patient showed you there were signs. Very, very, very few times. I'm talking about sudden cardiac arrest. Your patient will go down with no symptoms. Outside of that, they're telling you with their body language that something is going on. But if you're paying attention to something else in the environment, your cell phone, and guys, I have seen that. Walking patients, the cell phone. Where's your attention? Yeah, not on your patient. So we've got to be really careful here to make sure that our focus is in the right place. Does that make sense? And in order for them to determine that, they put this in your way. Sneaky, I don't like it, but I understand the reason for it. And it's probably keeping patients safe out there. Make sense? So be aware of it. That's why it's in our checklist. Okay, good. Questions? All right, so this is not a hard skill. We're going to stand a patient up with a gait belt. We're going to ask if they're dizzy because I want to know that when we're at the chair. I don't want to wait until I'm 5 steps away and ask, hey, are you dizzy? And if they say yes, what is my exit strategy? I mean, I have no options here. Now, what a lot of CNAs will do when your patient starts to get a little wonky on you, they have any of those symptoms, they get dizzy, they get weak, they start to, go back and forth, anything like that. What most CNAs are going to want to do is rush them back to that chair, get them back to safety, right? You don't want them to fall, so you try to rush them back to the chair. Guys, they're not tolerating a slow walk. What makes you think they're going to tolerate a rush? And yet CNAs will do that all the time. Your patient gets a little funky on you, they try to rush them back to the chair, they don't make it, and they fall. Well, yeah, they're going to fall. So what should we do? Well, if we have a patient that's showing us symptoms that they're not doing well, we're going to get them to sit on the floor. Because a patient that's sitting on the floor can't fall on the floor. And falls are where injuries happen. So when I'm walking a patient, this is me, my patient is here, slightly in front of me, and I'm off to one side. I'm holding that gait belt underneath, just like this. This hand is feeling for any of this kind of stuff, okay? It's feeling the speed that we're walking. I'm gonna let my patient lead. I'm not dragging them anywhere. I'm gonna have my hand under here, my patient is leading, my focus is here. If my patient, as we're walking, starts to get a little funky on me, right? As we're walking, I'm gonna plant this foot right between their legs, grab the gait belt with my other hand and pull them back against me. Now they're leaning on me. I am supporting their weight. And on the count of 3, we're going to slide right down my leg onto the floor so that I know my patient is safe and not going to fall. Okay, it's controlled. And then I'm going to yell for somebody to go get me a nurse. Hopefully I won't have to leave the patient. I can grab another CNA. There's usually you're within yelling distance of the nurse's station. So you yell for a nurse or you get somebody to go get a nurse for you. Try to stay with the patient. If not, if you have to, make sure the patient is safe and then run to get the nurse. But ideally you want to stay with them. This is why, if you've ever been in a clinical setting, nurses' stations are visible and centrally located. And there's a lot of planning that goes into developing any type of acute care setting or long-term care setting. And that's specifically so that the nurse's station is never out of earshot of a patient area. You can always get help. Make sense? Good. Do we ever rush a patient back to the chair?
No.
That could be a written test question. That's unsafe. Very unsafe. All right. So it says the patient's able to walk, yay, but needs assistance to stand. So that's what I want to talk to you about now. We're going to go over body mechanics. So we've heard most of this already, okay? The patient's feet hit the floor, we talked about their shoes. We talked about that with foot care. You guys remember that? Slipper socks are not enough because they don't protect the feet against sharp injuries or pathogens. But here, we're going to focus now learning these steps. So when we put a gait belt on a patient, we want 4 fingers between the gait belt and the patient. That way we know it's snug enough. So let me show you what a gait belt is and how to use it. This is a gait belt. It is a flat canvas belt with a free end and a buckle. It's just a belt. When you put this on it goes around the patient's waist, not yours. When you put this around the patient's waist, it does not matter if the buckle is facing this way or if the buckle is facing this way, nobody cares. Doesn't matter. What matters is the tag goes inside, just like every other article of clothing. So if I put this around my patient's waist, you want to make sure that it's flat, and not twisted. Right? You don't want it twisted. You want flat. starting that low carb thing, looking at that. That's sobering. All right. So once you get this around the patient's waist, the free end goes through the first guard by the alligator teeth. So I'm going to take this free end and feed it through that first guard by the alligator teeth. And I'm going to pull it this way until it tightens. Now I can't pull it this way because those alligator teeth won't let me. I have to pull it this way. So I want this snug around the waist. If it's too loose, if you leave it too loose, when you try to lift the patient with this, it's going to go underneath their breasts, underneath their arms, or they'll just slide right out of it. We need it snug enough it's going to stay in place as we lift our patient. Now, our patient is sitting when we put this on, and we get skinnier when we stand. When we sit, everything kind of spreads a bit. When we stand, it elongates. So when you put this on with your patient sitting, it needs to be snug. You should only fit 4 fingers between the belt and the patient. That's it. Once you got it snug enough, we have to lock it in place. So this free end goes through the second guard now to lock it in place. This tail hanging down might get in your way, especially with you little teeny people, because it's going to be a long tail. So you can pick this up and just slide it in the belt to keep it out of the way. Now at the end of the skill, when we're all done and we go to remove this belt, we're going to reverse the process, but it's a little bit different. We're going to take it out through the second guard. That part's the same. But to remove this, see how those teeth are biting into it? You can't just like try to pull this. It's not going to go anywhere. It's locked in. So what we have to do is hold the buckle and slide the buckle along the belt. So to put it on, we pull the belt. To take it off, we slide the buckle. Good? When you take this off, do not pull it from around the patient. Listen to the sound. You guys hear that? That is a burn. Okay? We don't pull that around the skin. What we want to do is either reach our hands behind to grasp the belt, or you can loop up and over holding that buckle because you don't want it to bam hit your patient's head, right? So hold that buckle, loop it around. Important not to hold. Good? Questions? Make sure your gait belt is snug enough. So let's talk body mechanics. I get to sit down for this part. Oh, remove obstacles. We learned that. We talked about shoes. Body mechanics. All right. So if you look at, I'm going to, let me get over here to the camera real quick. I want to show you guys. Okay. So that way you guys at home can play along a little bit. If I'm sitting in this chair, if I'm the patient, and I am sitting in this chair, and you guys at home may not be able to see this really well, but you know, the floor has squares on it. Do you guys see the squares? Mm-hmm. There's a line right in front of my feet. Do you guys see that line from the squares? And there's a line on each side of this chair. So I am literally sitting in a box. Now I'm going to use that box for body mechanics, for foot placement. It used to be years ago that we trained people to stand in front of our patient, knee to knee, toe to toe, and lift the patient toward us. So it would look like this. Okay, if I had a patient sitting here, I would be knee to knee, toe to toe, and I would lift the patient up this way. Now, there's a physics principle you may have heard in high school. Every action has an equal and opposite reaction. You guys remember hearing that? It's a physics principle. It is a law. You can't get around it. So if I am picking a 200-pound person up, knee to knee, toe to toe, that is 200 pounds of force that's coming my direction. My back has to compensate for that. So my body is going to go backwards with about 200 pounds of force. That's probably going to knock me off my feet. I'm going to be unsteady. So now we are at risk of falling, both of us. And if my back is able to absorb that weight, it won't be long before I end up with back problems. So this is not a good body mechanics stance. Does that make sense? Mm-hmm. Can you see how that would be problematic? So instead, we're going to, let me remind you here. Remember, we have a line in front and a line on each side. We were in a box. So instead, we're going to use that box for body mechanics. Instead of standing in front of my patient and having all of that force come toward me, I'm going to stand in an oblique angle or a sideways angle. If I have my patient sitting in the chair, I'm going to put my foot in front of their patient, feet across. This is perpendicular. This foot is going to go parallel with the chair, like this. So I'm standing at the corner of that box. I'm going to bend at the knees, not at the back. I want my legs to absorb this, not my back. I'm going to have the patient put their hands on my shoulders. I'm going to reach around to the back of the gait belt, and on the count of 3, because I want them to cooperate, on the count of 3, we're going to stand. 1, 2, 3. Notice that they didn't pull me off balance. It's safer, has less risk of injury, and is actually a little bit easier to perform. Okay, good? Questions? So we're going to use this body mechanics. So you can see that here. We have a foot in front across their feet so they don't slide out, a foot beside, and we are going to grab the back of that gait belt. We want to be as far around the back as we can. Remember, that's the heaviest part of the patient, right? We want to lift where the weight is. So we want to be around toward the back of the gait belt. Now, if you turn back a page, to page 45, this goes over that process. But if you look at the picture at the top of the second column, do you see that patient? Do you see the position the arms are in? Arms are straight down, right? But because they're pulling at the center, that's causing the center to go and the arms, the shoulders to go back. Do you see that in that picture? That patient is off balance and at risk of falling. What we want to do is move this patient as a unit. So when we do this, do I have a slide? Yes. When we do this, I want to have my patient's arms on my shoulders, just resting, not around my neck, just resting on my shoulders. When I do that, I move the patient as a unit. Nothing is trailing behind. Everything stays in line. Good? Mm-hmm. Okay, so this is the position we should be in when we're lifting a patient. Oh, thanks. Let's see here. Actually, I'm going to leave it like that right now because I want those at home to be able to see body mechanics as I lift. All right, so this scale, pretty easy. I need a volunteer. Somebody come sit in this chair. All right. So I'm going to do the skill from beginning to end, but I am going to simulate hand washing because it's my third skill. Remember, after the first skill, the evaluator told me I could simulate hand washing. Okay. One other thing. I don't know if you noticed when I was sitting in the chair earlier, I have short legs. Mm-hmm. My feet do not hit the floor flat. I'm kind of on my tippy toes, right? Because I'm kind of short. So I need to make sure before I lift this patient that their feet are flat on the floor. And if they aren't in a sitting position, my patient needs to scoot forward a little bit. I never lift a patient if they're on their tiptoes. It'll cause them to fall forward. Okay. So I'm going to ask the patient, are your feet flat on the floor? Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you? Good. Fantastic. Do you feel like going for a little walk? Sure. All right, let me go close your curtain, wash my hands, get my supplies, and I'll be right back. Just going to move this table out of the way and wash my hands. Close the curtain first. Wash my hands. All right, Miss Jones, I'm going to put this gait belt around your waist. This is going to help me lift you to a standing position, okay, and provide a little stability. So lean forward for me just a little bit. Okay, relax. I'm going to put this through the first guard by the alligator teeth. Oops. Without the microphone. Okay. Where am I here? Through the first guard by the alligator teeth. And that's twisted. Okay, one more time. There we go. Through the first guard by the alligator teeth. And we're going to snug this up. I'm going to check it with 4 fingers and then lock it in place. We'll put this right there. Okay, I see you have shoes on. Are your feet flat on the floor? Yep. Okay, feeling all right? Yep. What we're going to do is you're going to put your hands on my shoulders. I'm going to grab the gait belt, and on the count of 3, we're going to stand. And then we'll stand there for a second until you get your bearings, okay? So go ahead and put your hands up here. And on the count of 3, we're going to stand. 1, 2, 3. Good? Mm-hmm. Feel that support? Yes. Okay, are you dizzy at all? No. Remember, I want to know here. All right, whenever you're ready, you're going to walk over to the corner of that table. We'll turn around, and we're going to come back to the chair. You're going to lead. Okay? Okay? Good. Very good. Go ahead and turn around. This way. Feeling okay? Yep. All right, go back to the chair. Now turn around and back up so your knees hit that chair. Mm-hmm. Can you feel it behind you? Yes. I'm going to help you sit. You're going to turn them this way just a tap. There you go. You're going to put your hands back on my shoulders. I'm going to help you sit on the count of 3. 1, 2, 3. Okay. Now I'm going to remove that gait belt. I'm going to loop it over. There we go. Are you comfortable? Yes. Is there anything else I can get for you while I'm here? No, thank you. Okay, we're going to pretend that you're close to the bed and can reach the call light. Okay. For the test, the chair would be way closer to the bed, but I needed it out here so I could demonstrate. So here's your call light. If you need anything at all, it's in reach. My environment's clean. Are you comfortable? Yes, I am. Very good. Just let me know if you need anything. I'm going to open your curtain. Put my gait belt away. Wash my hands. Think about my skill, make any corrections, and then tell the evaluator my skill is done. Thank you. Good? All right, anybody have any questions on that skill? Oh, Debbie says, very informative channel, step by step. I'm so grateful I got on. I got some knowledge. Oh, thank you, Debbie. We're glad that you joined us. All right, so our checkpoints for this particular skill, see if I did it properly. Did I apply the gait belt while the patient was sitting?
Yes.
Did I apply the gait belt around the patient's waist over their clothing?
Yes.
That's important. Please don't remove their clothing to put the gait belt on. Did I help the patient stand by holding the gait belt on both sides or the back? Yes. Did I let the patient lead? Yes. Did I walk slightly behind into one side, holding that belt underhand? Mm-hmm. Did I ask how they felt?
Yes.
Mm-hmm. Did I assist the patient when standing and sitting? Yes. And when I removed the belt, I didn't slide it against the skin. Now, one thing that is not on here that was on shoe rules, so we want to go back to shoe rules here real quick. There we go. So we learned that 4 fingers have to be between the gait belt and the patient. We learned that feet must be flat on the floor, and we learned that we're going to count to 3 before we lift. We also learned to ask if they were dizzy. But this checkpoint, I really didn't talk about too much, so I want to talk about that now. When I did this skill, I asked her to back up so that she could feel that chair behind her, and I asked, can you feel the chair? And that's because I'm going to help her sit. If she doesn't know that that chair is behind her, she's not sure there's anything there to catch her. So when I try to sit her down, she's going to unconsciously kind of stiffen up because she's afraid of falling. Does that make sense?
Mhm.
When you ask the patient, when they turn around, to back up so that they can feel that chair, now they know it's back there and they can sit without fighting you on it. This is important every single time we try to help a patient sit in a chair, whether it's a chair, a wheelchair, a bed, doesn't matter. They need to know something's back there to catch them. Okay? And then proper body mechanics are what we learned with 1 foot in front, 1 foot beside. All right. Last skill. Doing good. All right, so if you go to page 86 in your book, page 86. This is where it all comes together. If you look along the top here, you'll see that almost every single principle we've learned is integrated into this skill. We're going to follow the care plan. We're going to do the opening. We need to use a barrier. We have to evaluate if we need gloves. Linen rules apply, so we're not going to snap or shake them. We don't hold them up against our clothing, and we dispose of them properly. Our patient's going to be uncovered and undressed, so we need we're going to turn them on their side, so after the turn, they have to be in the middle of the bed. We're going to wash stuff. Washing rules apply. Then we have to clean our basin after that, and we have to know how to do the closing. So almost every principle that we've learned is included in this skill. If you look at the bottom of the page, you'll also see it's the longest skill we do. You have somebody with your level of experience, which is none, should be able to give a partial bed bath in 19 minutes. Guys, that's a long time. I mean, an incredibly long time. So if you get this skill on the test, you're going to get 2 super short skills to go with it. Like measure and record respirations and range of motion. Right? 2 super short skills to go with it. So it's not a bad skill to get. You're just washing a body face to waist. That's it. Washing a body face to waist. Front and back. I mean, it's not hard. Anybody ever wash a baby? Mm-hmm. Yeah, you've got the basics down, right? Whatever we wash, we rinse. Whatever we rinse, we dry. Yeah. Not much here. But there's a lot of steps. This doesn't end on one page. It actually goes on to the next page, right? There's a lot of steps involved here. But there's a couple things I have to point out. Again, we're just washing a body face to waist, front and back. But the face is what I want to talk about first. When we wash the face, we don't want soap on the face because soap dries the skin. And if it gets in the eyes, it's going to sting really bad. So no soap on the face. We're just going to rinse the face with water. Does that make sense? But there's a special process that we need to use when we're cleaning wet body openings. So if you go back, to, hold on, I gotta find it for you. 85. We're going to talk about the chain of infections. So our washing rules, we actually know all of these washing rules except for this. I started going over it today and realized I was ahead of myself. So we're going to use the leaves method for body opening. So I'm going to explain to you what the leaves method is in just a minute. But I want to review the chain of infection. Do you guys remember going over this on the first week, the chain of infection? Right? For the chain of infection, we have to have a bad guy. We have to have a place for it to live. And it's happy in its place. It's going to stay in its place unless it has a doorway out, right? Well, your eyes, your nose, and your mouth are convenient doorways to your body. So if we are going to wash any wet body openings that can allow stuff to flow out, we need to make sure that we think about infection control because stuff may be coming out of those doorways and we don't want to spread that around. So I'm going to show you the leaves method. One for you, one for you, one for you. You. You're welcome. Okay. So what I just handed out, those of you who want to play along at home, go get a washcloth. This is just a plain washcloth, a square washcloth. You probably have one of these in a linen closet somewhere at home. We usually have them folded in half and then half again when we store them, and this is kind of how they're laying on our shelving units at home, right? But instead of looking at it as a square, looks like a square, right? Instead of looking at it as a square, we're going to turn it and look at it as a diamond. So a diamond is just a square, rotated a little bit. And when we look at this as a diamond, we want all those free corners at the very top. So turn your diamond until those free corners at the very top. And then we're going to put this diamond on our hand, our dominant hand, and we're going to tuck in that side corner between our thumb and our index finger, and this side corner between our pinky and our ring finger. So you should have something that looks like this. This allows us to keep control over all those corners so we don't have floppy corners getting all over the patient. This keeps control over the washcloth. There. Yeah, I know. We're actually going to turn that just a little bit. Let's see here. Hand? Yeah, you got tiny hands. Very tiny. We're going to go here. There, and under the pinky. Here, and now you've got leaves at the top. So the whole point is to have your leaves at the top. So yours, we're going to turn this way. Because you want those leaves at the top where your fingertips are. Okay? So, oh, thank you, Kalichi. Thanks so much for this practical training. Really coming in handy for me. Thank you. All right, so we have a washcloth. The leaves are at the top, and we're controlling it with our hand, right? This allows us to wipe a wet body opening, like an eye, and then fold that corner over, and that traps the contamination underneath. Now, we've got a new cleaning surface that we can wipe the other eye. Fold that over, and it traps the contamination underneath. Then we can wipe the mouth and fold that over and trap the contamination underneath, giving us a new cleaning surface. And then we can clean the nose. I always do the nose last because boogers, you know. Yeah. This allows us to clean 5 independent cleaning surfaces because once I use that 4th one, I can fold it over and use the back side as the 5th. Good? Mm-hmm. Pretty cool, huh? One washcloth can clean 5 areas without cross-contamination.
What would the 5th this side be used for?
So we're not going to use it for partial bed bath because we're just going to use eye, fold over, mouth, fold over, nose, right? But if we had the peri area, which we're going to learn on Wednesday, we want to go down the middle, down the middle, labia, skin fold, that crease between the leg and the groin. So we need 5 leaves for that. Good? Makes sense? Guys, if you are a parent, you will use this method way more with your kids
Mm-hmm.
than you will with at work, right? This is a huge saver of supplies. Good. Questions? Pretty cool, right? Okay. So this is the leaves method of cleaning. And we're going to use the leaves method anytime. Oh, thanks, Debbie. All this time I thought knee to knee was the way. Thanks again. You're welcome. You're welcome. Here to help. All right, so we're going to use this leaves method anytime we're washing wet body opening. So wet body opening is an eye, a nose, a mouth. Ears not so much because things usually don't come out of the ears. You know, if they do, that's a bigger problem, like way bigger problem, right? So eyes, nose, mouth is what we're looking at here. Genitals, certainly. Rectal area, yes. But also wounds, rashes, sores, and incisions. So if we're going to be washing an area that's near an incision, we need to use this method to prevent contaminating the incision area and prevent anything that's coming out of the incision from contaminating other areas. Remember, a doorway in can also act as a doorway out. Good? Make sense? So this is our leaves method here. So we have the folded corner in the palm of our hand, the free leaves at the top. We use leaf 1 and fold it over. That exposes leaf 2. Leaf 2, fold over, exposes leaf 3. Leaf 3, fold over, expose leaf 4. And leaf 4 can fold over and use the back side if we need it. Good? Just like that. You should have seen me trying to make that graphic.
Do you use a separate rag to like clean your cheeks and your forehead?
You can use one of the leaves
Oh, okay.
on so the way that I do it, you're going to see this in the video. Eye, fold over, forehead, cheeks, mouth, fold over, nose, fold over.
Since you can't use soap on the base, it would just be water.
Just water. Yeah. So because we're not washing with soap, we don't have to rinse. This is our rinse, right? So we're just going to dry.
Okay.
So we're going to wash the face with plain water and dry. But now, let's go. We're going to go back to the care plan and read it. Then everything else is going to need soap. So whatever we wash, we rinse. Whatever we rinse, we dry. Okay? So let's go back to, where is it? There it is. All right, so let's read the care plan here. Care plan tells us to provide a partial bed bath. So hold up just a second. Partial bed bath. That means we're not doing the whole body. But not everybody's partial is going to be the same. So if they need a partial bed bath, it better tell you in the care plan what part makes up the partial part of this, right? So this care plan is going to be very extensive. So our care plan says, give the resident a partial bed bath and a back rub. Let's stop there for a second. Time out. We are not massage therapists. We do not deep tissue anything. We do not work for a massage company. That's not what we're there for. Any of you guys ever get sick when you were a kid? When you got sick, mom came along, probably rubbed your back really lightly, makes you feel better. Yeah, it just makes you feel cared about and cared for. Makes you feel better. And when you're sick, you really want to feel better, right? That's all we're doing here, guys. We're making our patients feel better. There is no sexual undertones to this whatsoever. Okay, so don't get all freaked out about giving a back rub. This is simply to open up the capillaries, restore circulation, because they've probably been laying around a while, and to make them feel better. So quick back rub. We're going to start at the base of the back, go up in small circles to the shoulders, come back down, and we'll do it 3 times. Up and down, 3 times. That's it. But we have gloves on because body fluids, we're around wet body openings, body fluids. We have gloves on. Gloves against skin can burn, right? Friction. So what do you think we need to use to make the back rub work a little better? Lotion. So we're going to get a little lotion. We're going to warm it up in our hands, rub the lotion on, little back rub, and then we wipe off the lotion with a towel at the end. That's it. That's our back rub. Okay. So it tells us to give the resident a partial bed bath and a back rub. Now it's going to tell us what makes it partial. Wash the resident's face, neck, chest, abdomen, back, and one arm and hand with soap and water. One arm and hand. Do we care if the patient has two? No. We don't know why it says one arm. We have no idea. Maybe the patient is having a procedure done later today, and soap and lotion affects the outcome of the procedure. It does on some things. So they don't want you washing that side. Maybe the patient's had an amputation and that side isn't even there. Right? Maybe the patient has a huge cast on one side. Who knows? There's a million scenarios I could give you. It really doesn't matter. It says one arm and hand because for the test, it's all they need to see. If they watch you wash one arm, rinse one arm, and dry one arm, they don't need to see it on the other side. Where do those evaluators want to be?
Home.
At home in their pool drinking their Mai Tais, right? They don't want to watch you wash another arm. So that's why the care plan is cut down to just one arm and hand. Makes sense, right? It says provide a brief back rub with lotion. Dress the resident in a hospital gown. Patient is lying in back and center of bed and can roll as directed. The problem is, if we look down, this is going to be done on a mannequin. So care plan says they can roll as directed, but you're actually going to be doing the rolling. Okay? It says patient's too weak to assist with bathing. Not a hard skill. There's a whole lot of body parts listed there, but you can break it down into face to waist, front and back, one arm and hand. Okay. Good. 19 minutes. It's a huge amount of time to wash a half a body. It doesn't take 19 minutes. But they give you all the time that you need so that you don't rush through this. Do you think it's important that we talk to our patient? Yeah, remember that they are going to be undressed. They are laying down, which is, by the way, a very vulnerable position. If you are doing this skill silently, can you imagine how awkward that is for them? It's awkward enough that they got to have a complete stranger wash all their dangly bits, right? That's awkward enough, but to do it in silence, that's horrible. So you need to be talking to the patient. If you don't know what to say, at least describe what you're doing. I'm going to wring the washcloth out. Okay, we'll wash your chest here, your neck, behind your ears. Talk it out. But you need to be saying something. Because if you aren't talking, they're uncomfortable. I can guarantee it. And on the test, do we ever want our patients uncomfortable? No. So super important here to understand the patient experience. Jock says there are so much things that is very hard to do, but this class is making it very easy. Oh, thank you. That's what I'm all about, is making things easy. All right. So any questions on partial bed bath? Any questions on partial bed bath? I'm going to show you the video for this one, primarily because it has really good close-ups, and there's a couple things here that you kind of need to see that the camera shows better than I could do live in person. But if you practice this one, and this is one I do recommend that you practice here in the classroom, because most of you don't have a life-size mannequin at home, and if you do, I don't want to know about it, right? So this is a good one to practice here. But if you can't stay in practice, if you have no way of practicing here, this can be done on a baby doll at home. It's the same process, just on a smaller package. Same process, though. So you can practice the steps on a baby doll. Okay? Or a baby, if you happen to have one of those. They aren't selling those at the store, but you know, if you happen to have one. Good? So this is one that you probably really do need to practice here. And that's because the mannequins don't turn the way you think they're going to. They're a little bit harder to maneuver, to work with. So you're going to have to work with one on the state exam. So it is a good idea to get the practice in here before you get to the exam. And that's one of the reasons that today starts practice time built into the program, because you have enough skills behind you and you've mastered all the principles, we've gone over all of them, that I can kind of open it up for practice for you and you can feel a little bit more comfortable with practicing. Good. And there is a method to my madness. You will have, like I said, probably about a half hour or so of practice today. Maybe a little bit more, but there's a couple things I need to go over with you after this skill before I open it up for practice. So we're not quite there yet. But let me show you this skill, this video. All right. Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you? Good. I need to do partial bed bath. Is that okay? I'm going to close your curtain. Let me wash my hands, get my supplies, and I'll be right back. For this skill, I'm going to need a barrier for the table. This will give me a clean place to put my clean supplies. For this skill, I will need 4 washcloths, 2 towels, a clean gown, and a privacy blanket. It's a washing skill, so I will also need a basin, soap, and lotion. And I'll need a set of gloves. Miss Jones, let me go get some water. I'll be right back. Miss Jones, is this water appropriate temperature? Okay. And now I'm going to spread the privacy blanket out over you. This will help keep you warm and protect your privacy while we do this skill. I'm going to spread the blanket without snapping or shaking the blanket. And I'm going to pull your sheet down to about your waist. Okay, Miss Jones, I'm going to ask you to sit forward for me in just a moment so I can untie your gown. And I'm going to spread this towel out underneath you to keep your sheets dry while we bathe you. Can I assist you to sit up, please? Thank you. I'm going to untie your gown and spread the towel out on the bed. Go ahead and lay back down, Miss Jones. Thank you very much. And now I'm going to spread the towel out underneath the arm. I'll remove the gown on the side closest to me, supporting the elbow as I lift it. And I'm going to relocate the gown to the other side of the patient. This leaves the patient uncovered underneath the privacy blanket for bathing. The blanket will keep you warm. Now I can apply my gloves. I'll take the first washcloth and wring it out. And I'm going to use 4 corners. We'll wash the face first, no soap on the face. Miss Jones, I'm going to wash your eyes. I'll start with the closest eye to me. I'm going to wash from the inner to outer corner. very gently, and then we'll fold this leaf over to prevent contamination from spreading to the other eye. Ms. Jones, I'm going to wash your other eye now, inner to outer corner. We'll fold that leaf over, and then I'm going to wash the remainder of the face. Using very gentle strokes and keeping control over the washcloth. We'll fold that leaf over and use the final washcloth for the nose. And then we'll set that aside. I'm going to take the towel and pat dry all areas of her face, making sure not to use too much force. We'll set the towel aside. We're going to take the second washcloth and wring it out. And we'll apply soap to the top leaf. We do not need to use the leaves method because all of her skin from this point is intact. We're going to wash behind the ear, under the chin, across the neck, the upper torso. We're going to lift the blanket to protect privacy but keep the patient covered while we wash down to the abdomen and up the side. Now for the exam, you are going to make sure the patient remains covered until the evaluators ask you to remove the blanket. At that point, you will just continue on. I am going to repeat these actions so that you can see what I have done. I'll remove the blanket for better visualization. Behind the ears, across the chin, the neck, the upper torso, around the breasts, down the abdomen, and up the side. Then we'll clean down the front of the arm, the hand, up the back of the arm, lifting at the elbow, and the armpit last. We'll set this washcloth aside because it has soap on it. We'll take the third washcloth in the basin and wring it out. And we're going to rinse all the areas that we just washed. So behind the ear, under the chin, across the neck, the upper torso, around the breasts, the abdomen, up the side, down the front of the arm, keeping the elbow supported on the bed. We'll rinse the hand, the back of the arm, and the armpit while supporting the arm. The rinse washcloth can go back in the basin for later use. Now we're going to dry all of those areas. So we're going to pat dry or use short, soft strokes, but nothing vigorous. Go ahead and lift your arm, Miss Jones. We'll set the towel aside. Now the patient has a clean torso, so we'll place the clean gown on her. Miss Jones, can you reach your arm through here? I'll help you put your gown on. We'll lift the arm at the elbow, supporting it as we lift. And we'll spread the gown out. Okay, Ms. Jones, I'm going to go around to the other side of the bed now, and we'll dress the other arm. Since the care plan said that we only needed to wash one arm, we do not need to cleanse this other arm. That's per the care plan, but we do need to dress it. So I'll remove the soiled gown, and we're going to place this in dirty linen. And then I'll put the new gown on. Ms. Jones, can you reach through this armhole? Thank you. And go ahead and lift. Thank you. Okay, Ms. Jones, I'm going to ask you to turn onto your left side now. This is going to allow me to wash your back and give you a brief back rub. So I'm going to ask you to scoot toward me, and we're going to roll you onto your left side. Ready? Go ahead and scoot toward me. 1, 2, 3. Now the evaluator will hold the mannequin in place while you complete your cleaning. So I'm going to take the third washcloth, wring it out, And we'll soap the top leaf. I'm going to wash the back of the neck, the shoulders, and the back down to the waist. We'll set that washcloth aside. We'll take the final washcloth and wring it out. And we're going to rinse all of those areas. The back of the neck, the shoulders, and the back down to the waist. And then finally we'll dry all of those areas. The back of the neck and the shoulders, the back down to the waist. Now our care plan asks us to give the patient a brief back rub. So we're going to use a little bit of lotion, making sure to warm the lotion in our hands before we give them a back rub. Ms. Jones, I'm going to give you a little back rub now. I'm going to start at the small of your back and work my way up in small circles to your shoulders. We'll do this 3 times. This is for circulation purposes. 1, 2, one more, and 3. I'm going to wipe off the excess lotion. Now I can tie the patient's gown. And remove the towel that's protecting the linens. Ms. Jones, come on back onto your back, please. And scoot to the middle of the bed. Thank you. I do not want to touch that sheet that's going to go right up next to her face with soiled gloves, but I need my soiled gloves to take care of all of my dirty linens. Ms. Jones, I'll be right back. These items are going to go into dirty linen. Now I'm going to go clean the basin. I'll empty the basin and rinse it, and then pick it up with a paper towel. I'll dry the inside with one paper towel and throw it away, and then dry the outside with a paper towel and throw that away. And I'll get one for the drawer. I'll collect the soap and the lotion, placing them in the basin, and return the basin to its drawer for storage. Paper towels can be thrown away. This barrier is going to be discarded, and now I can remove my gloves. Okay, Ms. Jones, I'm going to remove your privacy blanket now and pull your sheet back up. Are you comfortable? Good. We're going to roll the privacy blanket in a ball so that the trailing edges don't contaminate other surfaces. This will be placed in dirty linen. Okay, Ms. Jones, is there anything else I can get for you while I'm here, such as a magazine? No? Okay, here's your call light. If you should need anything at all, please let me know. I'm going to open the privacy curtain and wash my hands. After washing my hands, I'll think about the steps of my skill, make any corrections, and tell the evaluator my skill is done. All right. Any questions? Any questions? That is the longest skill that we have. I don't think it's particularly hard, but there's a lot of steps to it. So it's really easy to get kind of all tangled up in the steps as you're practicing it. But try to reduce it down to the principles, right? Whatever we wash, we rinse. Whatever we rinse, we dry. We follow the care plan. And yeah, I mean, it's, if you think about it in those terms, the steps actually become a little bit easier. So this is what I created for the new book. So for every one of the principles, I created a page like this. And of course, it's black and white because I can't afford to have these things printed in color is like insanely expensive. So it's in black and white. But what I did, just like the flashcards, I put the skills that this principle shows up in. So this will be in the new book. Is that helpful? Mm-hmm. Do you guys like that? Okay. Then I also, for the skills themselves, I made this page. So this has the principal, the principal check or pieces that we see on the screen that you guys don't have now. It has the gray box, which you have at the beginning. It has test-specific information, and then all of the principles that are involved, all written out. So you can see at a glance what each of these steps would be. Do you think that's helpful for each skill? I did that for every skill. And then this page changed just a little bit. I put the testing stuff, the stuff that's down here, I actually put that on the other page. And instead, I put pictures of all of the supplies. Is that good? Is that helpful?
Yes.
Okay. All right. So I'm going to leave these here. You guys can take a look through them and see if there's any suggestions you would like to make, or I'm welcoming input. If there's anything that I left out that you're, hey, this would be good to have in it, just let me know, and I'll see what I can do. Because it doesn't go into print until later this week, very soon. All right, so before we open it up for practice, there's a couple of things that I want to go over with you, and we're going to start at page 43. So I usually go over this when we talk about ambulate with a gait belt, but it really applies to so many skills, and that's why I'm trying to kind of separate it from ambulate and talk about it independently. We don't really think about the energy levels of our patients very often because we just assume that everybody's like us. But you aren't actually like you. And I'm going to explain that. Have you ever seen a 2-year-old?
Yes.
I love 2-year-olds. Man, they're just dynamic, right? Everything is new and exciting. I love 2-year-olds. And they have energy that is out of this world.
Yeah.
A 2-year-old will bounce up and down for no reason. No reason. They just, energy, man. Energy.
When they get to 5, they ask why questions.
Oh, yeah. Yeah, that's a fun age, too. But your energy level actually peaks out somewhere between 2 and 3. That is the most energy you will ever have in your life, is somewhere between 2 and 3. And it's really kind of amazing because it's all downhill from there. And you're so young that you don't have any frame of reference. You have no way of appreciating the energy that you have. But if you put a 12-year-old in charge of that 2-year-old for an entire afternoon, who's going to win?
2-year-old.
2-year-old. That 12-year-old will be begging, can you please put them down for a nap? Right? They don't have the energy to keep up with that. So just in that 10-year time frame, your energy level has dropped. Think about that. Right? Go out to 22. Now, 22-year-olds still have tons of energy. Man, they can shop till they drop and go out at night looking fabulous. Right? Stay out dancing all night. I don't have that energy. But you don't have the same energy that you had when you were 12. You just don't. Your energy levels decline through your lifespan. Now, at 42-year-old, 42, you'll shop till you drop, but that's like 3 and we're not going out tonight. Right? So energy levels have dropped further. At 62, we're looking at maybe retiring soon because there's just not enough energy to keep up with work and all the daily tasks you have to do. Your energy levels have depleted. We're probably putting our feet up for 10 minutes before we make dinner, going to bed a little bit earlier, right? So yeah, our energy levels have fallen even further. So what do you think they're going to be like at 82? Okay, and we don't stop to think about that, do we? We just kind of assume that everybody's got the same energy we do. Have you ever tried to explain to that 2-year-old why you don't have the energy level they do?
Yes.
They don't get it,
Not
do they?
understand.
They don't get it.
They jump hard.
Yeah, exactly. Well, come on. Just play a little, right? They don't get it. Well, guys, when that 82-year-old tells you that they don't have the energy for a shower today, you are the 2-year-old in that scenario. You're not going to get it. And you're going to try. Well, come on. just a little shower, right? You're not going to get it because you've never experienced that lack of energy. They're coming from a place that you haven't seen. Does that make sense? But you need to know it exists. And if I don't tell you about this, you're not going to get it. Well, why do we even care? I mean, old people, they have nothing to do and all day to do it. I mean, why do we care if they don't have any energy? So now we have to look at some of the things that we do every day that take energy. So what do we do that takes energy?
Move around.
Okay, so yeah, move around. Just walking takes energy. Sure. What else? Working, yeah. Working takes a lot of energy.
Thinking.
What?
Thinking.
Thinking. Have you ever been too tired to think? I sat at my computer at 9 o'clock last night staring at the screen because my brain was too tired to think anymore.
It's fried.
Yeah, it's tired. What else do we do?
Debbie has a question.
Oh, Debbie, should we lift the bed to a higher weight when doing higher height when doing a partial bed? Yeah, you can, Debbie, certainly. If you don't want to bend, I'm short, doesn't really bother me. I mean, I'm not very tall. So yeah, you can lift the bed to an appropriate height for partial bed. That's not a graded checkpoint. You're not required to. You can if you want to. But what do we have to do if we raise the bed? Lower it at the end of the bed at the skill. Now the problem is at the end of that skill, you're fried. Talk about fried, right? It's a 19-minute skill. You are fried. You just had to remember all the different body parts that you were supposed to wash, and then you had to wash them and rinse them and dry them, and then you had to change the gown and all this stuff that you had to do. So do you think you're going to remember at the end of the skill to put that bed down?
Yeah.
Probably not. So it's a risk. Just remember, you can raise the bed if you want to, but it is a risk. Make sure that you lower it at the end of the skill. Great question, Debbie. All right, so getting back to energy conservation, we have to think about all the things in our lives that we do that take energy. And for me, this starts with getting out of bed. Like half of my daily energy is getting my butt out of bed because I like being asleep, right? So that takes a lot of energy. But then what's usually the first thing we do when we get up in the morning? Go to the bathroom. Yeah, if you've got to go, don't you think the patient's got to go? So going to the bathroom takes energy. What about grooming? Does that take energy? Dressing? Bathing? How about eating? Do you think eating takes energy? Well, here's the defining principle to what takes energy, right? If you're not sure if something takes energy, ask yourself, have I ever been too tired to blank, right? Have you ever been too tired to eat? If you've ever been too tired to eat, you know eating takes energy. What else have you ever been too tired to do?
Everything. Driving.
Okay, so all of those things take energy. What about talking? Have you ever been too tired to talk? Talking takes energy. And yet talking is a very important part of our social experience, especially if we're isolated in a clinical setting, right? We have to be able to connect with others. So we need to understand the energy demands for our patients are very high and their available energy may be very low. So how do we balance this? Well, first we need to be aware of it. And then second, we need to listen to our patients. If they say, I'm too tired for my shower right now, believe them. If they eat better in the afternoon rather than evening, if their noon meal they eat better because they're so tired at the end of the day, then we need to make sure that they get to the dining room for that noon meal. So we want to make sure that we're accommodating the patient's energy levels. Does that make sense? Mm-hmm. But there's another part to this too that most people don't really think about, and that's individual preferences. Me, not a morning person, not by a long shot. A lot of people my age get up at 5 a.m., not me. I do not like early mornings. I function best from about 4 in the afternoon till about 2 in the morning. That's like my time to shine, right? That's when I'm awake and alert and more productive. That's why I do most of my writing is in the afternoons and evenings. I will work in the mornings, but I'm not as creative. I'm not as with it, right? Because my natural rhythms make me more of a night person. Make sense? Mm-hmm. Now, my husband, not a night person. He is a morning person. He likes to watch the sunrise. I think he's a little deranged, but that's okay, right? He likes to get up early. He functions best in the morning. He'll get up and have his coffee and do an entire day's work before I get out of bed, right? Because he has a different circadian rhythm. Make sense? So we have to understand that every person that we work with is going to have a little bit different rhythm to their energy levels. Good? We can't just dump all old people in one bucket and say everybody that's old gets up early and goes to bed early. That's not the case. But it also impacts how we do our daily tasks. Some of you guys are shower in the morning people. Some of you guys are shower at night before bed people. And some of you are shower both people, right? So we have different preferences. Some people eat a good breakfast in the morning, and some people don't eat anything until noon, until lunchtime. So we have to understand that the way we live our life isn't necessarily the way our patients prefer to live theirs. So when we have a patient that is on the morning shower schedule, and we try to get them in the shower at 6 a.m., and they consistently refuse, that's probably something you need to let the nurse know about. But I would probably ask the patient, do you normally shower in the mornings? Or are you an evening shower person? Right? Get some information. That way when you go to the nurse and say, hey, this guy has refused to shower 3 times this week, but I found out it's because he doesn't like morning showers, or he's not a morning person. Can we switch him to the evening shower schedule? That nurse you've just solved her problem for her, right? And then we can make a care plan that fits our patient. Does that make sense? But when we're talking about the elderly, we need to understand that the majority of them, not all of them, right? My best friend's husband's grandmother, I know that's a mouthful, right? She was in her 90s, and she babysat her great-grandson, drove, played cards, did all the grocery shopping, all of the laundry. I mean, she was just amazing in her 90s. I'm not half as productive, right? She was amazing. So there are outliers to this, okay? There are people that have insane energy levels all throughout their life. I get it. But when we're talking in generalities, usually older people are going to have a shorter energy level than what you have. So it's important that we understand things that we can do to help conserve some of that energy. So let me show you what I mean. Have you ever seen an older person try to get out of a chair? I call it the rock and roll method. So it would look something like this. We have an older person with decreased strength trying to get out of a chair. They start doing this, right? They're going to build up some momentum. And then they're going to try to get up. Oh, no. Start rocking again. Mm-hmm. You guys ever seen that? How much energy did that take? A lot. And if I've only got this much energy to get me through the day, and I've used a ton of energy just to get out of the chair once. Now remember, I got to get out of the chair to go to the bathroom. I got to get out of the chair to go to activities. I got to get out of the chair to go to meals, before and after the meal, right? That's a lot of chair getting out of. And if each one of them take that much energy, I'm going to be out of energy long before my day is over. So if we use the Gait Belt and help the patient simply stand versus all that rocking, we can help conserve energy and they can have a better quality of life. That's why we use a gait belt to help our patients, because there is a relationship between strength and energy. If your strength goes down, the energy required to do things is going to go up. Does that make sense? And as we age, of course, our muscle strength decreases, muscle mass decreases, so we do lose some strength. That means energy requirements are going to go up, and that's why they need us to help them.
Would we use the gait belt on a person, let's say, in their long-term care facility, and they have the remote controlled recliners that help them stand? Will we still use the gait belt on them?
Go by your care plan for that patient.
Okay.
I can't give you one answer that's going to fit everything. And let me give you some examples of one, okay? So let's say that we have a patient who uses a recliner to help them stand. And I tell you, or I don't tell you, you decide to use a gait belt with that patient. But that patient has a shingles infection all along their back and side. That gait belt irritates that shingles infection, and because they're open pustules, and causes the patient a lot of pain. In that case, was a gait belt a good idea? Probably not. Or let's say you decide not to use a gait belt because the patient has a recliner that stands them up, but the gait belt is about more than just lifting. It provides a little stability. Now you're not holding onto the gait belt, so you have no idea that they're starting to get a little weak and they fall. So I can't give you one answer fits everything. You have to go by the care plan for that patient. Good question. Any others? So you can read this lesson on page 43 and 44 about gait belt. It also talks about shoe rules, but it's I just wanted to pass that on to you so you kind of think about energy levels a little bit differently than your own. Because remember, right now you're the 2-year-old in this situation. You're not going to understand when they try to tell you they don't have the energy. Okay? Good? All right, so let's go on to page 47. And I'm just going to spend 2 seconds on this. You can read this lesson on page 47 and 48. So this is a question that comes up a lot. What if the patient says no? Answer is simple. Find out why they're saying no and let the nurse know. The nurse should know about all of the no's. Because if the patient is refusing something, that actually means that care is not being performed. And the nurse needs to know that. Okay? Now, one more thing. Let's go on to page 56. And we're going to talk about timing for the test. I told you that I think I'm done here. Yeah. Okay. I told you for partial bed bath that you had up to 19 minutes to do that skill, right? When you get your test, though, when you go for the test, they're not going to tell you got 19 minutes to do a partial bed bath. They don't do that. They give you a total amount of time for the entire test for all 3 skills. So if you keep your hand here on page 56, but just go back with me to page 17, you'll see all of those testing clipboards. You guys remember those?
Yeah.
The test sets. And you'll see the time in the top corner, 31, 33, 34, 35, 36, 37, 40. You see those?
Mm-hmm.
Okay, that's the amount of time you would have to do for that particular skill set. And I want to explain how they come up with that. So if you go to back to page 56, I'm going to show you the formula. It's at the bottom of the page, hard to read, but at the bottom of the page. So the formula is the amount of time for skill 1, the amount of time for skill 2, and the amount of time for skill 3, plus hand washing time and thinking time. So what does that mean? Well, For every skill set, remember you're going to have to wash your hands at the beginning of skill 1 and the end of skill 1. Well, they're going to give you 3 extra minutes for that. So your hand washing time does not count in your actual skill time. Okay, they're going to give you an extra 3 minutes. Cool. And they're also going to give you an extra 5 minutes for thinking. So they call this transition time. So going from skill 1, thinking about your steps, reading the care plan, telling the evaluator your skill is done, getting set up for skill 2, right? You get 5 minutes of time for basically thinking your skill throughout the whole test. And then they look at how long each one of those skills should take for somebody with your level of experience. And they add all of that up together, and that's how they get that number. So let's do this as an exercise together. Give me a number 1 to 11. 6. All right. Let's go to skill set 6. All right. So we are going to perform passive range of motion to shoulder, provide catheter care, and measure a drainage bag. So we're going to do this together. If you look at the first column halfway down, you're going to see a graph that tells you the amount of time for each skill. This is on page 56, halfway down the first column. You'll see a little grid there, a little table. So if you look at range of motion, how much time would somebody with your level of experience need to perform range of motion?
4 minutes.
4 minutes. So somebody write down 4 somewhere so we remember. Now look in that table for catheter care. How much time would somebody with your level of experience need for catheter care? 15 minutes. So we're going to add 4 and 15 together. That gives us 19. So far we're at 19 minutes. What about measure and record contents of urinary drainage bag? I've got it under here as empty drainage bag. 9. So 19 plus 9 is 28. So right now we're at 28 minutes. But I told you that they're going to give us 5 minutes for thinking. That brings us up to 33. And 3 minutes for hand washing. That brings us to 36. So this skill set, if you get it, this skill set, they are going to tell you you have 36 minutes to perform this skill set. The timing is across all 3 skills, not skill specific. Good? And this lesson explains how that works. I have a video on it too that shows you specifically how the formula works. Good? Questions? Questions? Okay, tonight you have 1 chapter of homework, chapter 7. It's another skills chapter. Again, make sure you're reading the pages or the paragraphs in between the skills. All right. So let me get you your review sheets. And then I will open it up for practice. Yes, Debbie, I have been too tired to sleep too. Yes, that is a thing. You're right. All right, so class 5 review sheet. Those of you who are playing along at home, you can download this on our YouTube channel. Okay.
So the wash glass in there.
Oh yeah, you can just put them over here. Okay, and you needed this, is that right? All right, so that concludes today's class. That is everything that I needed to show you guys and talk about. Here's the registration packet too. The rest of the class is going to be practice. Now, for those of you who are new to tuning in at home, I don't broadcast practice. I am going to end the feed here. That way my students feel comfortable enough they're not on camera. It helps them actually practice. So I'm going to go ahead and end today's lesson. Feel free to join us on Wednesday. We're going to be going over 3 additional skills. And if you're not practicing here, make sure you're practicing somewhere because you do need to practice for the test. Until next time, happy caregiving. Bye. Oh, quick question. I'm going back and forth between the book and flashcards. Is the book more detailed or is the content the same? I love the idea of being able to take the flashcards on the go. The book is always going to have more, Mira, the book is always going to have more information than the flashcards. Flashcards are a quick review. They don't take the place of the book. They're designed to work along with the book. Now, the new book that I'm creating, the flashcards and the book are going to work even closer together. But remember that the flashcards don't provide information, explanations, or instructions. They're just for review. So read the book for instructions. The flashcards will help you with reviewing and keeping it top of mind. Hope that helps. Great question. Is it okay to verbalize washing hands during your skills, or do you have to do it physically? This is Debbie. So Debbie, let me answer this real quick and then you guys can practice. Okay, so it's a great question. During the first skill, so when you get a care plan set like this, care plan set, first skill, at the beginning of the first skill during your opening, you're going to wash your hands. You'll do your skill at the end of the first skill during the closing, you're going to wash your hands for real at the sink with soap and water. And then after that, the evaluator will tell you can simulate hand washing. That means say. You don't simulate until you're told to. So simulate means say. They will tell you to just say when you would wash your hands after your first skill. Hope that helps. All right, we're going to go ahead and sign off, guys. I will see you next week, or Wednesday. Have a great day. Happy caregiving. Bye.